President Levin, this is Phil. I think all the members of the board have arrived, and we are ready to call the meeting to order if you so choose.
Yes, make a roll call, please.
Trustee Hallwax.
Here.
Trustee Listener.
Here.
Trustee Miller.
Here.
Trustee Mulvaney.
Here.
Trustee Reader.
Here.
Trustee Vree.
Here.
We have a quorum.
Thank you. Today's village board meeting is being conducted as a virtual meeting via WebEx software and is being audio recorded and simulcast on the village's Facebook page as the village continues to support social distancing to try to prevent the spread of COVID-19. Somebody's got something playing. A quorum of members of the board are present via remote access. Before we begin the formal business of the agenda, I would like to ask Village Attorney Steve Elrod to explain the legal basis for holding a virtual meeting.
Before we do that, pardon my interruption, could whoever has mics on that aren't speaking, please turn them off? I think that's how we're getting the reverb.
Thank you, President Levin. If I may proceed and if you all can hear me. I see by nods of head you can. Good evening. This meeting is indeed being conducted virtually. We're not present together at the Village Hall as is otherwise required by the Illinois Open Meetings Act. However, in light of the state of emergency that was declared by Governor Pritzker in March, there was a subsequent order that was entered by Governor Pritzker on March 16th that suspended the otherwise applicable provisions of the Illinois Open Meetings Act to allow for virtual meetings such as the one that is being conducted tonight in the village of Glencoe. Specifically, Governor Pritzker suspended the requirement that members be physically present in order to conduct the meeting, and in that order that was entered by Governor Pritzker currently is in effect until April 30th. It may be extended, but this meeting that's being conducted tonight falls within the parameters of his order. I should note for you that that particular provision, the suspension, has been tested and confirmed by the Attorney General of the state of Illinois himself and by the public access counselor of the Illinois Attorney General's office. Thank you.
Okay, thank you, Steve. Since this is a virtual meeting, to help us facilitate the meeting, let me set out a few of the things and ground rules. Again, I would echo Gary's request that anyone on the board that isn't speaking, please mute your line so that we can avoid having background noise. Members of the public are muted and should remain muted during the meeting. Members of the public should not share their video. To turn off your video, click the video camera button at the bottom of your screen so that the button turns red. After each agenda item is presented, I will ask each of the trustees if they have any comments or questions, and I called on the trustees in alphabetical order. I will ask for a roll call rather than voice votes on agenda items requiring a vote. Our first order of business, I would like to turn again to Attorney Elrod and ask him to introduce the first item on the agenda, a resolution regarding adopting a supplemental rule concerning public comments during virtual meetings of the Village Board of Trustees and other village boards, commissions, and committees. Steve?
Good evening again, President Levin. This is Village Attorney Elrod, and thank you for allowing me to introduce this item on your agenda. We have prepared for you a supplemental rule that would allow for the acceptance of public comment during a virtual meeting as the one you're conducting tonight in Glencoe. we have taken steps, and the village staff has taken amazing steps to ensure due process by all. Anyone who wants to observe and comment during this meeting or prior to this meeting and have their comments read at the meetings, has been given the opportunity to do so. Remember, this is a public meeting, not a public hearing. Members of the public have the opportunity to present their views, but it never is a two-way conversation, and it never is an opportunity to actually participate in the meeting. It is an opportunity to present comments at the meeting, and those comments can be presented in writing. That too has been tested in Illinois. And what we have done is provided an opportunity for the public to submit comments either by email or by a voicemail, which we would have transcribed. If the comments meet the parameters set forth in the resolution and are received by the village clerk 1 hour prior to the meeting, then they'll be read during the meeting. That's what's provided in this resolution, and it's on your agenda for approval. I'm happy to answer any questions that any trustee or you, President Levin, may have.
Thank you, Steve. I should mention that I will go over how we will treat comments that are made after we've finished voting on the supplemental rule. And we'll now go through the trustees alphabetically to see if they have any questions or comments. Trustee Hallwax.
No questions.
Trustee Listener.
No questions.
Trustee Miller.
No questions.
Trustee Mulvaney.
No questions.
Trustee Rubin.
No questions.
Trustee Vree.
No questions.
Thank you. May I have a roll call vote on the resolution, please?
Mayor, you a motion and a second, and then the roll call.
That's true. I forgot about that.
So moved. This is Gary.
Second, this is Joe.
Now, may I have a roll call vote?
Trustee Hallwax,
Yes.
trustee Listener,
Yes.
trustee Miller,
Yes.
trustee Mulvaney,
Yes.
trustee Rubin,
Yes.
trustee Vree.
Yes.
Excellent. In accordance with the supplemental rule the board just approved, here is how public comment will be taken at this meeting. The email address and telephone number designated for public comment for this meeting were published with the meeting agenda. During the public comment portion of the meeting, I will ask management analyst and deputy village clerk, Jordan Lester, to read the public comments that were received in compliance with the instructions that were previously published for the meeting materials. If a member of the public would like to submit comments during the meeting, please email your comments to glencoemeetings@villageofglencoe.org. Let me repeat. Glencoe meeting, that's singular, not with an S, Glencoe meeting @villageofglencoe.org. Comments submitted during the meeting may be read at the end of the meeting. Written comments should be limited to 200 words. All right. The next order of business is approval of the minutes of March 17th, 2020, our regular village board meeting. And I will go through and ask each of the trustees if any of them have any comments or questions with respect to the minutes. Trustee Hallwax.
No questions.
Trustee Listener.
No questions.
Trustee Miller.
No questions or comments.
Trustee Mulvaney.
No comments.
Trustee Rubin.
None.
Trustee Vree.
No comments.
May I have a motion to approve the minutes, please?
So moved. This is Trustee Miller.
Second, Jonathan.
May I have a roll call, please?
Trustee Hallwax,
Yes.
trustee Listener,
Yes.
trustee Miller,
Yes.
trustee Mulvaney,
Yes.
trustee Rubin,
Yes.
trustee Vree.
Yes.
Oh, excellent. At this time, I would ask Jordan Lester to read the public comments that were submitted prior to the meeting.
Good evening. Thank you, President Levin. This is Management Analyst Deputy Village Clerk Jordan Lester. We received one public comment, and I will read it now. It is from Joe Mayer. Every year around the village, there are certain areas that are considered low points where water pools for extended periods of time. There are two in particular on Green Bay Road by South Street and Dundee Road. During the hot months, which are upcoming, this will create breeding areas for mosquitoes. What is the village planning to do with these low points on village property to eliminate the pooling of water going forward?
President Levin, this is Village Manager Phil Corrali. If I can, I wanted to just make mention both of the properties that are pointed to in that email are Park District properties, and the village will be sharing this information with the Park District and working with them as well as with the North Shore Mosquito Abatement District as we approach the summer months to deal with those issues.
Actually had it yet that are alive to carry. It was in the winter and really know it.
Thank you. All right. The next order of business is that I'm going to go through and ask for the various reports. We did not have a committee of the whole meeting for this April session, and so I don't have any report with respect to the committee of the whole. But I will ask Trustee Gree to comment on this month's treasurer's report.
Thanks, Larry. So we are 1 month into the stub year 2020, and most of the data from this month really doesn't reflect anything that's going on now, because all of it came before the pandemic really hit. But some of the things to note, we have received the first half of our year's or the annual property tax payments. So that provides a lot of cushion as we move through the next couple of months in terms of the uncertainty around the timing of payments from the state of Illinois. So as we're heading into this, the village is actually in very good shape, and especially from a cushion perspective, where we have the bulk of or a big chunk of our revenue having already hit in March. And so the things that we'll be noting are some expectations, or actually some or more estimates of what may happen over the next few months. And Nikki and the finance are going to go through that as we later in the meeting. Because right now, first month, everything looks generally okay, if not fine. But sales tax and many of the other taxes are really going to fall off as we move through the year. So we're in good shape right now. Now it's just a matter of getting through the next few months and trying to get a handle on what we can do about it. Sorry, that's my report. Larry, you're still on mute.
I do best when I'm muted. Trustee Miller, is there anything new with the Plan Commission that you can report to us?
Not really new, but I didn't give a report at our last meeting since we were keeping it short. So I'm just giving the report a month late. So the Plan Commission met on March 4th. The only agenda item that we had was an application for preliminary appearance review for a proposed restaurant at the 668 Vernon property, and that was formerly an art store. The application for design review was approved subject to signage and a possible mural. So those will come up again when they come back before us for final approval. In case people are wondering what's going on with the Hoover estate, the answer is nothing at the commission level at this point. The earliest possible time we could possibly see the developer back again for an application for final approval, if they are ready, would be May 27th. And as a reminder, once an application is approved at the Plan Commission level, it would then go before the village board for final approval. And if there are any questions, I'd be happy to take them, but that's it for my report.
Okay, there being no questions, Trustee Hallwack, can you tell us what's going on with the Golf Advisory Committee and the golf courses? We have on and off with the governor whether or not we can allow golf.
Yeah, I believe Stella was going to speak tonight. I believe I see her on.
Yes, I am going to report during the PowerPoint on the state of the golf course at this point.
So as Larry, so I will defer to that if that's okay.
That's great. No problem. Trustee Mulvaney, all right, have there been some committee meetings or smaller meetings or process with respect to the Sustainability Task Force?
Yes, no little virus is going to stop the Sustainability Task Force from making Glencoe the most sustainable community in the universe. So we organized under the leadership of Elsa Bay subgroups where we're working together remotely to advance our various initiatives. So we are moving ahead with initiatives as we've been talking about here for the last few years. I would like to point out that Elsa Bay will likely be stepping down from the task force, and we would be in search of a new task force committee leader. So a call to the community for anyone interested in taking a leadership role and helping us with our mission. We are open as always and welcome volunteers to come and join us. That's really the report. Progress on all fronts, but nothing exemplary to report.
Thank you. All right, time for the village manager's report.
Well, thank you, President Levin. This is Village Manager Phil Corrali. It's nice for us all to be together, even though it's in this kind of bizarre virtual world. But I hope all are healthy and well, and of course, staying at home during this very unusual and difficult time. This evening, I wanted to provide a bit of an update on village operations that have been in place now for over a month, and I'm going to be assisted with that by Director of Public Safety, Carrie Lewandowski, in just a few moments. I also wanted to take an opportunity right now to introduce Gabrielle Cummings, who is the president of Highland Park Hospital. She has joined us this evening as well. She'll be in a few minutes providing an update on the efforts of North Shore University Health System as they combat the COVID-19 pandemic. So thank you, Gabrielle, for taking time out of your schedule to be here with us. We'll get to you in just a few minutes as Carrie and I walk through some updates for all of those listening at home or as part of the meeting. One mention I wanted to make, those of you who are visiting us and watching the meeting from home, please do remember, if you could, to mute your computers or your phones so that we maintain as good a recording as possible through this. Thank you. Obviously, we are dealing with unusual times, and as I said, I wanted to provide just an overview of what we've been going through at the village. I think as we all can appreciate, the past month has been really a time of remarkable change, which has required the flexibility of our staff and of our community, and now of the village board in the way that we're meeting virtually to deal with the effects of this pandemic. Since we last met, Governor Pritzker issued a stay-at-home order on Friday, March 20th. Then on April 1st, he extended it to last through April 30th. So we are about midway through that extension right now. Despite all of that, I'm pleased to report village operations remain 100% focused on the health and welfare of our residents and businesses, as well as on our mission to provide excellent customer service across all of our service areas. While we've had a few bumps along the way through this transition, the ability to adapt to the required changes is a testament to our really excellent staff. As I announced last month, all public access to our buildings ceased on March 16th. Most administrative staff transitioned to working from home, while staff that needed to report to work at public safety or public works or our water plant, as well as the maintenance staff at the golf club, have remained on duty, many of which in a modified capacity. Before I go any further, I'd be severely remiss if I didn't mention my sincere gratitude to our team for their dedication and adaptability during this time. I don't think any of us could have anticipated even just a month ago the rate of change that we've experienced. And while, as I said, not everything has been perfect through this transition, our ability to respond quickly and change course has been exemplary, and that comes from the leadership of all of our departments. I'd like to make sure to acknowledge Public Safety Director Carrie Lewandowski, Public Works Director Dave Mao, Finance Director Nikki Larson, Golf Club Manager Stella Nanos, and Assistant Village Manager Sharon Tanner for all that each of them are doing in leadership of this organization. This has been really a time to test leaders, and we're very well served by all of their contributions. So I wanted to focus first on public safety, and as you can imagine, even in pandemic response, our public safety department remains fully operational and ready to assist as needed. As I announced last month, we modified responses to certain calls for service, primarily in police, in an effort to maintain social distancing protocols. Without sacrificing our ability to respond to all calls in a safe and effective manner, all of our shifts in public safety have been reduced in size to better segregate staff and to protect their health as much as possible. We've developed some rotations for non-sworn staff and have limited as much as possible all staff-to-staff interactions across the entire operation. Personal protective equipment is available to and in use by all of our staff in public safety. And this is for not just their benefit, but also for the benefit of the public with whom they are interacting. This is especially important during paramedic calls, as you can imagine. As I mentioned, Public Safety Director Lewandowski is going to join in just a moment and outline some of the department's efforts regarding enforcement and management of the governor's stay-at-home order, as well as our public outreach efforts. Daily operations in public works were scaled back to limit the potential impact of COVID on the workforce. Staff in all of our public works divisions were divided into 3 teams to work rotating 8-hour days. That started back on March 17th. This structure has been effective at continuing to provide the ability for our teams to complete the critical maintenance work that the department undertakes daily, but also helps to limit our staff's interaction with one another. This came into exceptional focus last week when, unfortunately, one of our public works staff team was diagnosed with COVID-19 and was subsequently hospitalized. Because of the structure that was in place, this employee had limited interactions with other staff, which reduced the size of the group that needed to remain home in quarantine. Aside from that, I'm very pleased to report that our employee has been released from the hospital and is now recovering at home. And at this time, none of those in quarantine have exhibited any symptoms. And so we're certainly very grateful for that. One other point to make, we are implementing the use of masks for our public works employees who are working so that there are times where they may be in closer contact with one another than the 6 feet socially distanced standards. And any time that they may be in contact with the public, so they are wearing masks when they are out in public and working with one another. Additionally, the water plant remains fully operational and is continuing to provide the highest quality water to the community. As I mentioned last month, we did impose additional shift amendments in that operation and built some continuity plans that have been put in place to ensure that the plant remains operational under all circumstances. One other point, as the board is likely aware, on the consent agenda, there is a mutual aid agreement that relates to our water plant that will provide additional resources should we need to call on them, should there be an issue that comes up. In terms of building, zoning, and engineering, while working almost exclusively remotely, the employees in these areas are still reviewing building permit submittals and corresponding with petitioners, and they're doing so all electronically. We have continued to manage building inspections and have done so utilizing social distancing friendly FaceTime inspections, which is something certainly quite new for us. Our team is also on a remote basis processing things like pool pumping permits, over-the-counter permits, landscaper registrations, and a variety of other day-to-day functions. In addition, the main phone lines are being staffed into the Village Hall and are being answered remotely so that when people do call the village during business hours, they can speak to a real person, get transferred to those who they may be trying to get a hold of. Moving on to the finance department, thanks to their efforts, processing of payroll, accounts payable, utility billing, and vehicle and pet licenses has mostly been managed remotely, though Finance Director Nikki Larson has managed some of the required in-office efforts that have come up over the last month. As we'll discuss later this evening, one of the most important functions of the department in the coming weeks and months will be their efforts to begin and continue to measure the impact of the COVID-19 pandemic on the village's finances. Number of next steps that are being put in place, but some of those that we will be putting in place include a more frequent and forensic review of the receipt of revenues and the processing of expenditures on a weekly basis that will lead into our monthly discussions with the board. As for the village manager's office, significant work has been done managing through a myriad of personnel issues and policy development, spurred not only by this uncommon and very unprecedented structure that we're working through, but also by new laws passed by the federal government, some of which adjust things like the FMLA and other components of human resources law in response to the COVID-19 pandemic. Our IT team has also been working around the clock in an effort to ensure the village's network can sustain the needs placed upon it. With so much remote work taking place, quite frankly, with the level of cyber fraud and cybersecurity threats as well, that is adding some additional strain to our IT staff, but they're doing a great job and keeping our systems functional. In addition, an area that we've really stepped up is communication with the community. That has dramatically increased. We've utilized social media in a way we haven't ever since I've been here, in addition to twice weekly e-news updates that are being emailed out on Wednesdays and Fridays. Since March 15th, we've pushed out 9 e-news updates. Normally in that same period, we would have done 2. So there's a lot of work going on from that front as well. One thing that we're hoping people continue to use in their social media posts is the Glencoe Strong hashtag. I think it's a great message that focuses on the community and what we're doing together to get through this. Last and certainly not least, in accordance with the governor's order, the golf club is remaining closed to the public. However, maintenance activities are continuing. Management staff has also been busy putting together some operational changes that will allow less staff to patron interactions once the course is able to reopen to the public, realizing that even if the course is open, people may still have some anxieties about that. So the course is going to be prepared for that whenever the governor's order accommodates reopening the course. At this point, as I mentioned, I'd like to have Public Safety Director Lewandowski give a brief report regarding the department's efforts on enforcement and management of that stay-at-home order that I was just referencing, as well as some of the public outreach efforts that the department has been working on. Gary?
Good evening, everyone. My name is Kerry Lewandowski. I'm the Public Safety Director here in Glencoe. As Mr. Crowley said, I want to take a few minutes to talk about the Public Safety Department's role during this pandemic. We're here to serve. Glencoe Public Safety officers remain committed to providing police, fire, and EMS services all day, every day, just like they always do. However, the department has initiated minor operational changes to protect both residents and first responders from the spread of COVID-19. The Village Hall and Public Safety Facility is close to the public, so please call 911 for emergency services and 847-835-4112 for low priority non-emergency issues. Officers may respond with a phone call rather than a visit to your home for non-emergency calls. Also, officers may wear medical gear such as a mask, gloves, and protective clothing in certain situations, so please don't be alarmed. These efforts will allow us to support the needs of our residents and businesses while following necessary social distancing procedures to keep us all safe. Governor Pritzker has issued executive orders to limit the spread of coronavirus in Illinois. The order covers a variety of issues and remains in effect through April 30th, including a ban on large social gatherings, school closures, restaurant and bar service limitations, essential service and business designations, and stay-at-home orders. Safety officers will seek to educate, reinforce, and gain compliance with these orders as intended. We will use enforcement only as a last resort. Please don't waste public safety resources. Minor violations may occupy officers' time that could otherwise be used to assist someone in need of emergency services. If we all do our part and abide by the governor's orders, together we can reduce the spread of COVID-19 infections in our community. Stay at home, save lives, and social distancing. Centers for Disease Control and Prevention recommends that everyone practice social distancing to reduce the likelihood of spreading COVID-19. Stay at home as much as possible, remain 6 feet away from others, and wear a cloth face mask covering whenever you're outside your home. Avoid gathering in groups other than your immediate household members, and practice good hygiene. Wash your hands frequently, avoid touching your face, cover coughs and sneezes, and disinfect frequently used items and surfaces as much as possible. Please be mindful of these practices wherever you may be, whether you're walking in your neighborhood, shopping in town, or using the Green Bay Trail. Coronavirus has not eliminated crime in Glencoe. Car burglaries and auto theft remain a threat to our community. A recent car burglary was captured on a home security camera that verified that locked cars are not targeted. Cars parked on the driveways of 2 neighboring homes were targeted last weekend. One offender walked up the first driveway and attempted to open the car door. That car was locked, so he left it alone and joined his partner on the second driveway where they found an unlocked car. They burglarized that car and fled the area without being detected. Please lock your car and hide your valuables. We've also seen an increase in COVID-19 related telephone and identity theft crimes. Scam artists are taking advantage of the pandemic to target unsuspecting individuals in a variety of ways. For example, posing as medical professionals or government officials to obtain your personal identification information, soliciting illegitimate charitable donations for COVID-19 victims, and fraudulent fundraising for healthcare workers and first responders. Please remember to protect your personal identity information and verify charitable organizations before making donations. Community support in Glencoe has been inspiring. Many residents and local businesses have answered the call for much needed supplies and support for Glencoe's first responders. Whether it is through personal protective equipment donations, emails and notes of appreciation, offers to provide meals, or honoring social distancing requirements when interacting with officers and village employees, it is clear that our residents are being responsible partners in the village's fight to limit the spread of COVID-19 in Glencoe. In addition, the North Shore University Health System and the Cook County Department of Emergency Management and Regional Security have provided support and supplies for the coronavirus-related public safety operations here in Glencoe. All of Glencoe's first responders are equipped with the necessary protective equipment to ensure their personal safety and the safety of the general public. Park and beach access. Many of our neighboring communities have closed their parks and beaches in recent weeks, so many people are now coming to Glencoe since our park spaces remain open. That being the case, we recognize the impact on our residents and public safety, So the village has coordinated with the Glencoe Park District to ensure that patrons of our parks and beach abide by social distancing guidelines. Instructional signage has been posted at all parks. Parking near the beach has been altered to limit access. And park district staff members are monitoring the beach and parks to reinforce social distancing practices. Our mutual goal is to limit the spread of COVID-19 in our community as much as possible while providing recreational space for the general public. If you feel sick, stay home and call your personal health provider. If your children are sick, if someone in your household tests positive for COVID-19, or if you have serious underlying medical conditions, stay home and away from others and call your medical provider for guidance. If you are too sick to care for yourself at home or cannot get to the hospital, call 911. Otherwise, please treat at home under the guidance of your personal physician. In closing, I'm proud to say that our officers remain steadfast in their dedication to the community and will continue to serve and protect in these unpredictable times. Please visit the village website for up-to-date COVID-19 related instructions and information. And please remember, we stay at work for you, so please stay at home for us. That concludes my report, and I'm happy to answer any questions that the board may have.
If there are no questions, Phil, do you?
Thank you, Carrie. I appreciate it, and I know those listening also do. This is Phil Corrali, Village Manager. At this point, if there are no questions for Carrie, I'd like to again welcome Gabrielle Cummings, the president of Highland Park Hospital, who's joined us this evening. Thank you again, Gabrielle. We are looking forward to hearing all of the efforts that North Shore University Health System is undertaking to combat the COVID-19 pandemic. So the floor is yours.
Thank you, Phil. Good evening, everyone. Hopefully you can hear me okay. Great. So I'd like to spend a few minutes just to give you all an overview of what North Shore University Health System is doing in response to the COVID-19 pandemic. We've taken really a systematic approach to care. As you know, we are a 4-hospital system and recently welcomed a sister hospital in Swedish Covenant several months ago. And so we're a 5-hospital system, but we're really focusing the care for what we call North Shore Legacy for COVID patients to Glenbrook Hospital. And so all COVID, what we call patients under investigation or patients of interest, and positive patients are sent from our other hospital campuses to Glenbrook Hospital, which we've temporarily converted to a COVID and respiratory illness facility for the foreseeable future. For the Evanston Hospital campus, for the most part, if a patient is tested positive for coronavirus, they will stay there for the time being, but we're looking at the dynamic of whether or not to start to shift some of the Evanston Hospital patients to Glenbrook Hospital as well. Highland Park Hospital will remain and be a non-respiratory, non-COVID campus, with the exception of our LDRP, our labor and delivery unit, where we will care for moms who are COVID positive, as well as Evanston Hospital caring for moms who are COVID positive. By really centralizing our COVID patient care to one campus, it allows us to do 2 things. One, it allows us to be really good stewards of our PPE, which is in limited supply across the state and the country, but it also allows us to leverage and redeploy clinical resources so that we're only training one group of people to take care of COVID patients and really focusing that group at Glenbrook versus having people spread across the institution. So it helps us to leverage and better utilize those team members. In terms of our overall testing capabilities, we were the first healthcare system in the state to be able to test for COVID. And we are happy to report that we can test around 1,200 people per day. We have been collaborating with the state and other hospitals to really support testing needs. Just to give you a quick overview of what's happening in the state, the numbers are changing dramatically minute by minute and hour by hour. I was fortunate enough to give a similar presentation to the village, the city of Highland Park, almost 2 weeks ago, and the numbers were almost 50% less than what they are today. So in the state, we've had over 22,800 positives with almost 800 deaths. Within North Shore, we have tested 16,000 people. And in that 16,000 people number, 13,000 of those individuals are patients that are within the North Shore geography and the network. Of those 16,000 patients that we've tested, 3,700 of them have tested positive. And just to be clear, not all of these people are hospitalized. I know the number initially sounds really large. I'd say about 80 to 90% of those 3,700 patients are outpatients and people that we've asked to quarantine and stay in place, with the remaining 10 to 15% being patients that have been admitted or cared for within the Glenbrook Hospital campus and Evanston Hospital. In terms of the number of people we're caring for every day, the number is about between 75 to 100 people per day in the Glenbrook Hospital campus. And 2 weeks ago, the number was really in the teens. We were caring for 5 to 10 people a day, and that number has skyrocketed, just to show you how the virus has dramatically increased over the past couple of days. When we talk about what's happening in our operations at North Shore, late in March, we decided to cancel all the elective procedures and surgeries. And so, for example, those are things like GI procedures, elective surgical procedures, such as plastic surgery and a handful of other things. We do about 150 elective surgeries a day, and now we're doing about 5. And that's really to focus on only essential health care that is needed to take care of the people in our community. We closed labs at a variety of different locations. So for those of you all that are familiar with North Shore, we have laboratory sites that are located across our 20 immediate care centers and medical group offices and hospitals. We've reduced that number almost in half in order to make sure we're focusing our lab personnel on the critical areas. We also made changes to our visitor policy where we are allowing no visitors in the hospital whatsoever for our inpatients and only 1 visitor per mom in the LDRP, as well as our women's hospital at Evanston Hospital. We've also taken measures to ensure that all employees and visitors, which are very limited, but we do have a handful of patients that come in for some outpatient procedures, that their temperatures are all taken and they're screened for COVID criteria such as headache, newly onset respiratory symptoms, loss of taste, and loss of smell. That happens for every person that walks through our hospital doors. We also are continuously managing, as I mentioned earlier, the use of PPE, so masks, gloves, hand sanitizer, blood components, and lab testing reagents. We talk about it every hour of every day because it is a resource that is in limited supply across the state, the country, and the world, quite frankly, and it's something we have to really keep our finger on the pulse of. We also made a decision to focus our immediate care efforts into 4 immediate care facilities. We call them the super ICs. So these 4 immediate care centers are where we're driving all of our testing and healthcare related to COVID-19 versus having people going and dispersing themselves across multiple medical group offices and immediate care centers. And so those 4 super ICs, as we call them, have cared for over 9,000 people since the pandemic began, which is a really large volume of patients that we've had the opportunity to take care of. We also created what we call an e-visit platform via the North Shore Connect app for patients who didn't want to come into an immediate care facility and had the ability to do an e-visit, similar to what we're doing today with video conferencing. We have the opportunity for people to do e-visits and talk to a provider over a webcam or over their phones. We also opened our test tent and drive-through in the Old Orchard, not the shopping center, but where Peapod used to be. It's in the Old Orchard area. We've opened up a test tent where patients can call our Health 9 line to be screened by a clinician and determine whether or not they qualify for testing. And then they're referred to or sent to our test tent, which has cared for more than 1,700 people since we opened the tent on March 23rd. Also, as I referenced earlier, the Health 9 line is a line that we implemented in mid-March, and that line has fielded over 8,200 phone calls from people across the community wanting answers, having questions about what they should do in response to COVID-19. We've been very happy to be able to be a great resource for our community and answer questions and direct care as appropriate. In terms of our community involvement and outreach, I can't share with you enough how beautiful all of the communities around us have been for all 4 of our campuses and Swedish Covenant Hospital. We have been sprinkled with lots of love through flowers, tons of food. As I joked last week, we're calling it the COVID-19 pounds. We're getting food every day, all day. I would invite you to come eat, as I said last week, but you're not able to visit. So we are forced to eat all of the pastries and tasty food that comes our way all day, every day. But it has been beautiful to see the outpouring of love and compassion from you all in the community to let us know that you appreciate us. We're getting a lot of great letters, handwritten letters from 2nd graders, I'm sure, busy projects for them, but 2nd graders thanking us and telling us about losing a tooth. And they know the tooth fairy won't come, but it's been really a beautiful outpouring of support. And I would, on the other end, please encourage all members in the community to get tested if they're symptomatic. I would encourage you to call the Health 9 line, talk to your healthcare provider, but we need to make sure we're testing people that are symptomatic so we can really manage and control the virus as much as possible. So if I had some key messages to leave you with, Please know that it takes a village to take care of the COVID-19 patients and the pandemic. For every nurse, physician, PCTs, our EBS employees, our food employees, facility team members, lab techs, paramedics, police officers, everyone in the hospital and people are behind the scenes. It takes a village to take care of our community. So if you know someone that works in a hospital, take an opportunity to thank them and convey your gratitude. We know as a system that our planning and preparation has really paid off. The fact that we have focused as functioning as a system and shifting COVID patients to Glenbrook Hospital has really allowed us to care for more patients and not have a urgent or emergency response to having to care for people. We've been able to think methodically about how to care for people in the best way in our community. I would also offer that you all give blood. One of the other challenges that's happening in the country and the state are that with the pandemic, people are not going to blood donation centers and we are running low on blood and blood components. And so please go visit the North Shore Blood Bank and become a blood donor. When you go to the North Shore Blood Bank for blood donations, that blood stays within the North Shore system and we're able to provide that blood for the patients who need it most. As mentioned earlier, social distancing is critically important. We've seen that by social distancing and the stay-at-home order, we're starting to see the curve slow. It's not flattening yet. We're still seeing positive cases, but it is increasing at a slower rate. And wash your hands and stay home if you're sick. And I just want to thank you all for your patience, for your support, and for your outpouring of love, and for the time that I have today to share with you about what North Shore University Health System is doing to care for the community. With that, I can take any questions if there are any.
Hi, Gabrielle. This is Trustee Mulvaney. Hi. First, thanks so much. It's great to know that we're in such good hands, and I'm really impressed with all the steps that you've taken to help our community be more safe and to take the time here to share that with us. So thank you. I also am curious, as you describe all these changes, about the transition back to normalcy, and what do you think are your capabilities post-COVID, and are they impaired? What does the sort of future look like beyond the virus? Anyways, that's my question. Thank you.
Yeah, no, thank you, first of all, for the compliment and the question. Funny you should ask that question. We began our conversation today around recovery at work. So we know that COVID-19 is going to be a part of healthcare for the foreseeable future, and we can't allow ourselves to only focus on COVID-19. We've got to focus on that, but also focus on how to continue to provide care for patients that have been delaying elective surgeries or procedures because of the COVID crisis. And so we have a robust team that's just been put together to look at maintaining acute care for COVID patients, but also focusing on how we continue to support and grow healthcare in the community that we serve. So we're still very much early in the planning process. I would say in the next couple of weeks, we're going to have a pretty robust plan on how to systematically start opening up capacity in our surgical areas, opening up capacity in our facilities and our outpatient departments to start caring for patients that need to be cared for. I know for certain that telehealth and e-visits are going to become a permanent part of our healthcare model, which it wasn't before. We did it in a very reserved fashion, but we know that it's been very effective in providing care during the COVID crisis. So that will become a permanent part of how we care for our patients. We also know we're going to have to think differently about what patients come into the hospital and what patients should stay home and not come in. So it's still early, but we are starting to focus on now the next phase of recovery and providing robust care to our community.
Thank you.
This is Trustee Halwax. I have a quick question, and I would also reiterate what Trustee Mulvaney said. Thank you for everything that you do. I just have a really quick question, and it's something that's been bothering, I think, lots of people, but why are there no tests? You know, rovers on Mars, we can have Tesla make ventilators, but we don't have tests, and it's just baffling because I can't, but if any comments you have are appreciated.
Sure. I think it's, this has been the $10,000 question. What do we need to do to get up to the governor's goal of doing 10,000 tests per day in the state? I think it's a very complicated situation, right? You have a limitation around the number of instruments that can perform the test. You also have to balance the amount of supply and reagents that can support the machines to do the testing, as well as the people and personnel to to perform the test. And so when you put all those factors together, it's very difficult for some organizations, if they're smaller hospitals or smaller facilities, to produce enough tests to care for the population that we're seeing. I'd say in the past week or so, we're starting to see the testing capacity and volume increase as vendors like Abbott and bioMérieux and a host of other people are really pushing out more equipment to healthcare facilities to begin to test. And then lab technicians are a very unique breed of individuals. They have very specific training that they require in order to perform testing, and there are a limited number of them. And so I think all of those complicating factors have driven why our testing numbers are lower. But I know that we're getting closer to at least our state goal of doing 10,000 tests a day. Not to toot North Shore's horn too much, but we were the first in the state, and I really think that's related to Dr. Karen Call, who's our chair of pathology. Her vision of saying, Gabrielle, we need to be ready to do as many tests as possible because this is going to hit us and we need to be available. And so that's an indirect and direct answer to your question, but it is a multifactorial reason for not having enough testing. But I know each hospital across the country is looking for strategies to grow that testing, as well as the commercial labs.
Thank you.
Gabrielle, if I could ask a question, this is Trustee Vree. Again, thank you for everything you guys are doing. It sounds like you guys have done truly an amazing job in preparing for all of this. And so my question is just sort of whether trends are consistent with your planning and whether you're capable of handling everything that's coming, whether we're already close to peak cases, and just whether you guys are prepared, just your views in terms of how it's all going.
Yeah, so I would say we are absolutely prepared. We have a group of probably 60 people or more that meet every day to talk about a host of 10 to 15 different things, to get status updates and report on how we're doing around supplies and what are the testing implications and what do we need to do to make sure we have enough capacity to care for COVID patients and non-COVID patients. But we're absolutely prepared. We still take care of people through our emergency departments that aren't COVID patients. I think by centralizing our COVID patients and respiratory illness patients to one hospital campus has really opened up our ability to focus on COVID in one place and non-COVID across our other infrastructure and our other facilities. And so we continue to be proactive and push the envelope on how to provide care and be on the cutting edge of unique ways to think through delivering healthcare in this challenging period. We put up our test tent on March 23rd, which was something that was out of the box for us. We put up a test tent probably in 4 or 5 days, which really helped us open up capacity and support the community. And we also launched our e-visits in a very short amount of time because we knew we needed to be creative and thoughtful to provide healthcare for the community. And I would say a lot of the North Shore leaders have been around for a really long time, and we work really well as a team, and we're well connected in the industry and the state, and we like to do things that are outside of the box, thinking outside of the box to really do what's best for our community. So I would say that you all should feel safe and certain that all of our North Shore facilities will be able to take good care of you and your family members and all of our community members. But we are ready for what is here today and what will come in the future.
Thank you.
Gabrielle, hi. This is Trustee Miller, and I will reiterate the gratitude that we and the community at large feel. I'm curious about how your staff is doing, both in terms of the physical. Are they, getting infected, and in what kinds of numbers? And also, this must be incredibly hard to deal with.
Yeah. So thank you again for the compliment and expression of gratitude. Our employees are resilient. They are an amazing group of individuals who are doing everything they can to provide great care for our patients, as well as much self-care as they possibly can at this given time. It's not easy. There are patients, unfortunately, that pass away every day due to COVID. And that's traumatic for people to see that every day, or to see someone who may have walked into the hospital healthy and ends up leaving the hospital not healthy. For every patient that we do see that passes away, we are excited to report that we're starting to see people get discharged. 2 weeks ago, when people were coming in and getting admitted to our ICU with COVID, they weren't leaving. And we are happy to say that people are now getting discharged home and are able to be healthy and happy with their families. We are doing a lot to support our employees. We have provided resources through our mental health department to do group meditations or have pastoral care services come and talk to clinicians that want to have time to decompress and talk about what's going on. We've offered an opportunity for all employees that don't want to take their clothes home to their family members. They have an opportunity to take showers and to change into scrubs while they're at work, and then to change back into their personal clothes when they go home, so they feel safe that they're not taking any materials or viruses home to their family members. And then we also do a lot of rounding to provide support and find out what are they concerned about, what are they hearing. There's some things that we can't help with. For example, wearing an N95 mask and wearing a face mask is a very difficult task to do every day, all day. They're not comfortable, they're hard to breathe in, and that's something that we can't change for them. All we can do is surround them in love and support, hear their concerns, and do what we can to really respond and make sure they have what they need to take care of our patients. So those are a few things that we're doing, and we stay very connected to our employees by listening to them, rounding, and trying to be a good, solid foundation for them.
This is Gary Rubin. Let me reiterate deep gratitude that we all feel for what you and your entire team are doing for all of our community. Thank you. You just mentioned that previously, when this first started, people were coming into the hospital and their odds of leaving weren't very good. And it sounds like now people are coming in and their odds of leaving are getting better. Are there different treatments that are now available, different procedures that you're now doing? I'm just wondering what's changed. Thank you.
So absolutely, thank you for the question. I don't want to pretend that I'm a clinician, so I can't speak specifically to the science behind why people are getting better. We do think in part it may be that more individuals are getting tested sooner, and so because they're getting tested sooner in the course of their disease, we're able to help mitigate and manage preventing the disease from getting worse sooner rather than later. I think that may be one driving force for what's happening. I think that may be the primary reason. I know that there are different clinical studies that are going to start rolling out. We're one of a handful of organizations in the Chicagoland area that will start the collection of convalescent plasma. We don't know the use for that yet. So convalescent plasma is this concept of collecting plasma from patients that have tested positive for COVID and then using that plasma to care for those patients that are acutely ill. But I don't know the exact details behind why people are getting discharged more outside of being able to test them earlier and provide them care sooner in the course of their treatment. But I can definitely get a better answer for you from one of our clinicians when I talk to them offline.
You have more than enough to do. Thank you.
Okay.
But I very much appreciate it. Thank you.
For your time. I appreciate you.
And Gabrielle, thank you so much for spending your evening with us. You've got a lot going on in your world, and we do deeply appreciate it. We deeply appreciate the partnership with Highland Park Hospital and our public safety department and all that we've done together over the years. And so this is at this time particularly valuable that relationship has been so strong, and we just deeply appreciate that continues through this. And thank you again for taking time out of your schedule to be with us.
Absolutely. You're welcome.
Thank you, Gabriel, very much. We appreciate it, and you're terrific.
Thank you very much. Good to see you all. I'm going to sign off if that's okay.
That is okay.
Okay. All right. Have a good evening.
Stay well.
Thank you. You too. Be safe.
I do have a few other things I'd like to talk through this evening, just as a further report out on some of the things that we've been focused on, and that relates to our business community. Obviously, this has been probably one of the most unexpected situations for the cadre of small businesses that exist here in Glencoe. And frankly, for all businesses everywhere. And certainly what we have been trying to do since all of this started was to make sure we've been available to our business community. So as the board will recall, The village has a business services team. That team is made up of 3 individuals, our assistant village manager, Sharon Tanner, our management analyst, deputy village clerk, Jordan Lester, and our development services manager, Taylor Baxter. And all of them have been staying in close contact with our business community throughout the past month and then some. Most recently, the team has been personally reaching out to our restaurants, retailers, car dealerships, salons, fitness businesses, realtors, our chamber, and more to keep an open line of communication going to try to understand how their businesses are operating during this unusual time, and then to ask how the village can be a resource to them. One of the things that we've been doing over the last probably a couple years now is our business before hours events. These have been fairly popular with our business community, and in an effort to continue that, we actually do have one scheduled for this coming Tuesday, the 21st of April. I believe it starts at 8:30 a.m. And this one is going to be focused on marketing and business assistance programs that have been made available by the county, state, and federal governments. Along those lines, we have also been working to help to promote our business community through the village's social media and other communications tools. We've kicked off several campaigns. You may have heard of them: Distance Socially, Shop Locally, Takeout Tuesday, which is really encouraging our community to avail themselves of the prepared food at our restaurants that are offering takeout and delivery services. We made it onto the radio last week with our social distancing bingo game, which was, again, an opportunity to try to remind our community of the things to still be able to do in town, even though you may be stuck at home. And we've just tried to add interest into what people are seeing coming across their social media feeds and other things like that. The business services team is going to be pushing additional social media campaigns, all of which are intended to help promote and spotlight our businesses. We've created a page on the village's website that now lists businesses that are open and how they're providing service to their customers in this changed environment. And so that information is available to the community. We are pushing it out on a regular basis and updating it on a regular basis as things change. And we've also been trying to find ways, again, to make our business community, make it easier for them to conduct business. One example, the village president and staff worked quickly to implement temporary rules that have allowed restaurants with liquor licenses to sell packaged beer and wine for delivery or carryout with the purchase of food. In this environment, that's something that's critically important to them in an effort to generate some revenue. And that was something that we certainly wanted to be able to help them with. Finally, the business services team has developed and sent over 20 email blasts to our businesses about those county, state, and federal small business assistance programs. And we're continuing to educate ourselves on those programs in order that we can be a resource to the business community. These are not simple programs to understand. They are not necessarily things that are in our wheelhouse most of the time. But this group has really taken it upon themselves to be resources and assets to our business community. We've gotten some real positive feedback, and we're going to continue doing that. Our business community is the heart of this town, as we all know, and what we can do is to assist them in this way. So we're going to continue those efforts. To kind of bring the COVID-19 report to a close, I would just like to express my gratitude to this community as a whole, to the village board, the village president, to our staff, to the people who live here and the people who work here. This is not easy, what we are dealing with. It is easy for no one. The staff that are working, the people who are home now suddenly learning how to e-educate their children, the folks who have been laid off. This is a troubled time, and what I have been so impressed with in this community has been the willingness and the ability to come together and to support one another. People are supporting our small businesses. People are finding ways to support one another. We are listening to stay-at-home orders. Glencoe continues to have one of the lowest rates of confirmed cases of COVID-19 on the North Shore. That is something that we need to continue working toward, and we need to continue our efforts toward. It doesn't mean that we can relax and put our feet up. It means we have to keep doing the things that we've been doing, the social distancing, the being mindful of the rules that have been set in place, and to be thoughtful about those that are, as Public Safety Director Lewandowski mentioned, responsible for helping to enforce those rules by not making them have to do so. So we do deeply appreciate the support that we're getting at the staff level. We could not do this without this community. And as coming from somebody who has worked now at home almost for 5 weeks exclusively, I am in awe of the people that come to work every day in a very uncomfortable, uncertain environment, and they do it with a smile on their face. And we really are deeply well served in this community by the folks who care so much. That's not just the village. Those are the people that are working at the Grand. Those are the people that are working with the Park District and School District and Library, trying to create things for this community that are helping through this time. So we are very blessed, and I think we've got to keep at it, I guess is my message as I move on to some other things that are generally not COVID-19 related, but nevertheless are still important. I just wanted to make that statement and again express my gratitude to everybody listening, and especially to the Village Board for your continued support of what we're doing at the staff level. I did, as I said, have a couple of other things I wanted to report out quickly, just for the benefit of the group. One of them is COVID related, though somewhat indirectly. We are in the process right now of beginning to look at our summertime events. As the pandemic response has been front of mind, we've been discussing those events that are scheduled for later this spring and throughout the summer, both internally and with our community partners. Front of mind, these include our Memorial Day ceremony, our 4th of July celebrations, our art festival, and the weekly French market. As we've discussed these things, obviously Memorial Day is the first of these events to be coming up. It's just about 5 weeks from now. Given the timing of Memorial Day and the potential lasting effects of the COVID-19 pandemic, we are recommending at this point that the public ceremony be canceled and that we investigate alternate ways of commemorating those who fought and died for our country as we normally do in person on Memorial Day. One of the things that we are planning to do is to outreach to the Glencoe Historical Society and try to discuss how we might do something in a virtual way that is still an appropriate commemoration, but which also respects the social distancing restrictions that may or may not be in place on May 25th, which is the day of Memorial Day, but nevertheless may still be very much front of mind. I wanted to bring this up this evening for the board, and if the board is supportive of this, we would begin to publicize and again work toward finding an alternate means of celebrating Memorial Day in 2020. No one has any, sorry.
Let me call on the board members individually so that we can go through it in a more orderly way, starting out by saying, given everything that I'm seeing and that we're doing within the village, I suspect the public is not going to be feeling comfortable gathering in a large body on Memorial Day. Joe, do you want to comment as to what you think?
I agree. I would postpone the Memorial Day activities. I'd mentioned to Phil the other day too. I would think that in terms of 4th of July, that's probably still a stretch. If there's a way for us to consider moving 4th of July to, I don't know, October or something, and doing a one-off kind of 4th of July in October, I would consider doing something like that.
Thank you, Joe. Gail?
No, I also agree that Memorial Day is coming upon us very soon, and that exploring the virtual alternatives that Phil mentioned would certainly be a prudent idea. Even 4th sounds very soon. I mean, given all the uncertainty right now, I don't think that this is going to be the year for summer gatherings and summer festivals.
Barbara?
Yes, I agree. I think that, obviously we all hope that the social distancing restrictions will be lifted, but I very much hope that it will be in a very gradual way, and obviously large gatherings would be the last thing that would get lifted. So I would be in favor of finding alternatives both for Memorial Day and for 4th of July, regardless of what restrictions are in place at the state level.
Peter?
I think celebrations are important, and we need to find alternatives if we're going to cancel these outdoor events. Nobody's arguing against that, but I do think we need to be creative and try and find some alternative solutions. Memorial Day seems pretty logical. July 4th, I don't know. I wouldn't want to make that decision right now. It seems unlikely, but I don't think we're forced into any decision at this point unless there's a administrative timeline I'm not aware of in order to make that decision.
Gary?
Peter's comment is well taken. I do think it's important, but I can't possibly see it being a good idea to have a large public gathering for Memorial Day. And frankly, Peter, I guess I'm a little less optimistic than you. I don't think we'll be there by July 4th either. And I would just want to take that into account in thinking of alternatives, because I know that there's a lot of advanced planning to that particular event that does need to go into effect.
Jonathan?
Yeah, I'm in total agreement on the Memorial Day function. Seems certainly we shouldn't have something that a large public gathering on Memorial Day. I guess I would still also lean towards putting it off if possible, in terms of making any sort of decision on the 4th of July. Obviously, we're going to be leaning against having something on the 4th, but unless we need to start making decisions right away, I would still prefer just to keep that as an option, even if it's unlikely.
I guess I would summarize, Phil, for your consideration, the way that I think we're reacting to this, that we all agree that doing something for Memorial Day, because May 25th is coming on us quite quickly and we need to make decisions on that, trying to find an alternative would be an excellent idea, and that we should begin to be thinking about what we would do if we can't do the 4th or any form of the 4th, or whether a slimmed down version. And fortunately, we have another board meeting before we have to make that decision. But I think we all favor beginning to look at what we would do if we have to postpone the 4th, so that we have ideas to consider at the time. But definitely, I think we all support going to the Historic Society or doing something to find a better way to do the 25th.
Well, and I appreciate those comments, and we will begin to publicize and the Memorial Day changes, but we'll also be working, as I mentioned, on trying to find an alternative way to celebrate. I will say we have begun our conversations with the Park District. They are our community partner on 4th of July. We are not at a point at this time where a decision needs to be made. If we were, I would have brought that to you tonight. But your comments are very, very helpful They do fall in line with some of the initial conversations that we have had. And those conversations are looking at how we could potentially postpone things like fireworks to later on in the year. We do have a contract with our fireworks provider, so it's in our interest if we don't do it on the 4th of July to find an alternate date for that. So we will continue those conversations, and I will keep in contact with the village board relative to the 4th of July as that dialogue is ongoing. The other two that I mentioned, events that I mentioned, one of which is the French Market. If you'll recall, that's an event that is sponsored by the Chamber of Commerce. They were informed earlier this, or I should say late winter, that the contract with the provider of that French Market was not going to renew the contract. And so at this time, they do not have a vendor to facilitate a French market or a farmer's market of some sort in 2020, which may or may not be the worst thing in the world as we work through some of the restrictions that may still be in place or may not be as we get into farmer's market season. So I will keep you apprised on that if something changes. Last but not least is our art festival, which is scheduled at this time for July 25th and 26th. That's Saturday and Sunday. As you'll recall, it takes place in the downtown. I do anticipate further dialogue with the festival organizers. I had a conversation with them earlier this week about what their plans are, and they have been putting in place a number of operational changes that they may be able to easily integrate into any of their shows that they do. But it was caveated with, this is all about making sure that the public is safe and secure. If the village is uncomfortable with those dates in July, perhaps we could look at dates later on in the fall. And so I'm gathering some additional information, and that will also be shared with you as soon as I have it. But I think as we kind of go through the next several weeks and understand a bit of what the next several months after those next several weeks may look like, that's when some of those decisions may be easier to make. So I wanted to just make sure you had that information at this time, and we will continue our dialogue about those events moving forward. I had two items that I was going to have Dave Mao provide a brief update on that are particular interest to the community. The first is the construction that's commenced on Tudor Court. That started on Monday and is underway right now. Dave, are you able to report out on that?
Yes, good evening. This is Public Works Director Dave Mao. Just an update on Tudor Court. The long-awaited start of construction, as Phil indicated, was Monday of this week. Work is proceeding rapidly in this time of a shutdown in the downtown. The curb removal on the south side of the street has been completed. All the brick pavers have been pulled up on the south side of the street. Underground storm sewer work is underway. And next week, we expect to complete the sewer work, pour the new curb on the south side, and begin some of the electrical conduit installation. So that work is off to a good start. Just to note, the Tudor Court will remain open generally throughout construction, open to through traffic. Glencoe Drive has been closed off as part of this project permanently and is being used as a staging area during construction. And as you recall, that will be cul-de-saced and closed off at the Writers Theater driveway. So that's it for Tudor Court. Regarding the Booth Cottage, the work has been underway the last 2 weeks on preparations for the relocation of the structure. All of the removal on the existing structure of portions that don't move with the house has been completed. Staff is scheduled to meet with the Historical Society personnel next week to review final details for the physical house move. And that concludes my report.
I would just add to that. Thank you, Dave. I would just add, again, this is Phil Corrali, village manager. We are a long ways off from that structure actually physically moving. There are a number of touch points that still need to be met, and not the least of which is continuing to engage with the neighborhood. And that is a partnership between the Park District, the Historical Society, and of course the village. There will be more than adequate time given in terms of notice prior to any changes taking place on the Park 7N site in particular. But we did, as we had that opportunity tonight, want to make sure we gave that update as well. And now I will cede the floor because the manager's report, I think, is one for the record book tonight in terms of duration. So I'm happy to answer any questions if there are any, certainly.
If there are no questions, I did want to say again how very much the board appreciates the yeoman's work and dedication and the excellent job that's been done by all of the staff, from the village manager on down through everybody in public safety and public works. This has been a very difficult time for the operation of the village, and I think it is operated magnificently due to the total dedication and the extreme hard work of all of our people. So on behalf of myself and the board, I want to say we truly, truly appreciate the good job that's been done, even if you did talk for a long time tonight.
Thank you. We do appreciate that.
On a different matter, the next order of business has to do with the question of extending the declaration of emergency that I had made at our last meeting. And to put that into perspective, I'm going to ask Steve Elrod again to explain why we need to look at that right now.
Thank you, President Levin. This is Steve Elrod, your village attorney, once again. Just reminding you that the declaration of emergency that the village president entered at the village board meeting on March 17th has had an expiration of 7 days, or had a 7-day effective period. At that meeting, that period of time can be, under Illinois law, extended by action of the village board of trustees. At that meeting, you'll recall, the village board of trustees extended the time period for that declaration of emergency to the date of the next regular, special, or emergency meeting of the village board, actually to the adjournment of that meeting. That would mean that the emergency declaration would expire at the adjournment of this meeting that we're in right now. Should the village board desire to extend the emergency declaration, it can do so by motion today. And I believe the village president is recommending that that be extended. I'm happy to talk to you about the date to which it can be extended. You may want to consider doing the same thing as you did before, to the date of the next of adjournment of the next regular, special, or emergency board meeting, or pick another date certain.
And to follow up for a second with Steve, I had recommended that we put before us as a board tonight, extending it till the adjournment of our next regular or special or next board meeting of whatever type, or emergency board meeting, because we can always end it at any time. But obviously, anytime we have a board meeting, it's appropriate for us to determine as a group whether we want to continue extending it. Clearly, the present circumstances and where the governor is, et cetera, to me say we need to go ahead and extend it, because even if the state were to end its emergency order, it will take some time and some efforts that will need to be done by our village management in order to put us in a position to do a similar ending. So I would recommend that we extend it till the adjournment of the next regular, special, or emergency village board meeting. I'll start with Joe. Do you have any comments or questions? Trustee Hallwax?
No, I would be in favor of extending.
Okay. Gail, listen.
Yeah, I agree. I think it sounds like a reasonable thing for us to be doing.
Barbara?
Yes, I think we should extend.
Peter?
Yes, extend, although I do have one question. I can't recall the implication of this on our other governances. Does the school board or library board or park board fall under this, or do they have their own emergency considerations?
If I may, President Levin?
Yeah. Do you want to comment, or I can either way?
Whatever is your pleasure.
You go ahead and comment.
This would be just for the village of Glencoe and the village president of Glencoe. They each of those bodies could, if they desire, enter their own order or declaration. It doesn't mean that the village president's order wouldn't govern all people within all areas of Glencoe, for which we. So the village president, if he were to enter orders pursuant to that declaration, could impact the way in which people interact. He hasn't done so, but the way in which people act on other governmental property. He could not, however, close down other governmental facilities. That would be within another jurisdiction. I hope that that's responsive, Trustee Mulvaney.
Yes, thank you. I'm in favor of extending till the next regular or special board meeting.
Jonathan?
I'm also in favor of extending it until the next meeting.
Thank you. Could I have a motion?
Also in favor of the extension.
Good. That was Gary that I missed? Okay. With that, maybe Gary or one of you could make a motion and I could have a second so we can vote.
So moved. It's Gary.
Second, it's Joe.
May I have a roll call, please?
Trustee Hallwax.
Yes.
Trustee Listener.
Yes.
Trustee Miller.
Yes.
Trustee Mulvaney.
Yes.
Trustee Rubin.
Yes.
Trustee Vree.
Yes.
All right. I have a somewhat shorter report than the other ones we've been having till now because mine ends with a reminder that our next regular village board meeting is currently scheduled for Thursday, May 21st, 2020. And I would mention, because we're so used to now wearing casual clothes as we do those things, we can put for May, we're going to hope instead of having snow like tomorrow, that we're going to have warm weather. So I will put into effect our normal summer rules for dress at the May 21st board meeting. All right, the next item on our agenda is the consent agenda. And since this is a virtual meeting, I will ask the village manager to go through and read each of the things that are on the consent agenda so that it's clear to the public and to ourselves what we're voting on.
Thank you, President Levin. Again, this is Village Manager Phil Corrali. The first item on the consent agenda, item 7A, is the March 2020 Treasurer's Report and Glencoe Golf Club Financial Report. Item 7B, the March 2020 Check Register for the Village of Glencoe and Glencoe Golf Club. Item 7C, ratification of the March 2020 Early Checklist. Item 7D, consideration of a resolution authorizing a memorandum of agreement to extend the village's IT supplemental staffing contract with Prescient Development. Item 7E, consideration of a resolution authorizing the village to join the Illinois Water Wastewater Agency Response Network and for the village manager to execute a mutual aid agreement. Item 7F, consideration of a resolution authorizing the village manager to execute a contract agreement with Visu Sewer of Bridgeview, Illinois for sanitary sewer lateral grouting improvements for a cost not to exceed $37,300. Item 7G, And the last item on the consent agenda, consideration of an ordinance authorizing the procurement of 2 used fairway mowers and authorize the disposal of certain surplus equipment by the Glencoe Golf Club.
Okay, trustee Hallwath, are there any items on the consent agenda that you want to discuss?
Not for me.
Listener, trustee Listener,
No.
trustee Miller,
No.
trustee Mulvaney,
You're muted.
Peter.
Muted.
Okay, trustee Gary Rubin, I remembered him this one.
No, Trustee Mulvaney wants to speak, I think.
Yeah, sorry about that, folks. So I did have a question about the lining, and I guess it's for a discussion with David. Tell me if now is not the time. But I've been in touch with MWRD. It so happens we had a long conversation about the requirements on a municipal lining for reducing inflow and infiltration. And they wanted to assure me and for me to assure the board that they are not mandating all sewers be lined. I just want to make sure we're aware of that as we think about our capital spending. Of course, I am an advocate of good sewer stewardship and would be happy to see the whole system lined to reduce I&I and improve our overall water management. But just as a point of clarification, I have it on pretty good standing from my discussions that there is no requirement to line the entire system. There's some requirements around I&I management, but not necessarily entire lining. So I just wanted to put that out there in case that influences some capital spending in the future.
Thank you, Peter.
I have no questions or comments on the agenda. Thank you.
Jonathan?
No questions.
All right, may I have a motion to approve the consent agenda, please?
So moved. Mulvaney.
Second, Miller.
May I have a roll call, please?
Trustee Hallwax.
Yes.
Trustee Listener.
Yes.
Trustee Miller.
Yes.
Trustee Mulvaney.
Yes.
Trustee Rubin.
Yes.
Trustee Vree.
Yes.
Thank you. Our next order of business is my asking Finance Director Nikki Larson to get out her crystal ball and talk to us a little bit about what the perceived impact and what we need to worry about with respect to the COVID-19 virus and how it's affecting our budget.
Okay. Thank you, President Levin. This is Finance Director Nikki Larson. And we're going to talk a little bit about the financial impacts about COVID-19. You can switch the slide for me, please. Okay, just a brief overview of what we're going to review tonight. I won't spend too much time discussing the pandemic. We've had a discussion at length about that this evening, but we'll just do a brief overview of what the impacts will mean for us and the village as we go forward, and then specific impacts and what we're recommending in terms of revenue monitoring, revenue loss scenarios, financial response, and projections as we go forward. And then lastly, we'll end on some discussion points that we're looking for feedback on as we move forward. Next slide, please. Thank you. So as everyone's aware, President Trump declared a national state of emergency in response to COVID-19 in mid-March. As a result, the federal government passed a record-breaking $2 trillion stimulus package, which included $350 billion in funding for small businesses, $250 billion in unemployment benefits, and we understand that there is a second package that is under negotiation right now. The state of emergency unlocked federal funding from FEMA, which is being funneled through the state agencies. And we do understand that this funding can provide personnel, facilities, equipment, and reimbursement funding. At this time, we're uncertain of which funding the village may be eligible for, if any. However, I can assure you that our public safety department has taken the lead on applying for this assistance, so we are in line when that assistance becomes available. As you've heard in the news, we do have unemployment soaring nationwide, particularly in Illinois. We have over 500,000 applicants for unemployment assistance since the pandemic or the stay-at-home order has started. And closer to home, Governor Pritzker issued a stay-at-home order first that expired on April 7th and was extended subsequently through April 30th. And we do think there is a good possibility that it will be extended again. Next slide, please. Thank you. Locally, obviously due to the stay-at-home order, we've had many businesses close or reduce or modify their operations. We do expect this pandemic to cause a lot of our economically sensitive revenue to decline, especially in the short term. As President Levin mentioned, it's difficult without a crystal ball to understand what's going to happen long term, but we are taking a stab at some long-term projections this evening. As many of you are aware, interest income and the market value of our investments has declined. We do expect that to impact things such as our investment income, our investment portfolios, and particularly our pension fund. So we will be looking at very closely our actuarial report for next year. As you recall, those investment returns are smoothed over a 5-year period, which will help, but we do expect that contribution to increase. And also, probably one of the more obvious impacts that we're experiencing are unanticipated expenditures related to responding to the pandemic. This includes everything from equipment, supplies related to disinfection, emergency medical response, switching to a remote work environment, and overtime that's related to some of the quarantines and the change in scheduling that we've been doing. Next slide, please. We are uncertain, as I mentioned, as to the duration and the percentage of revenue that we may lose over the course of time. However, we do anticipate that several of our revenues will be impacted by the stay-at-home order and the current state of the nationwide economy. On this slide, we have approximately 56% of the village revenue represented here and highlighted the amounts that have been budgeted for the stub year budget, which is the year that we are currently in. And just starting from top to bottom, given the extension of deadlines on many taxes statewide and by the IRS, we do anticipate that it is a good possibility that Cook County may extend the deadline for the second installment of property taxes this year. As Trustee V mentioned earlier today, we're fortunate to be in Lake County in that our first installment of property taxes was already collected. So we have received a large proportion of property taxes already, which gives us a lovely cushion as we go through this period of uncertainty. In the projections that are included in the packet, we do anticipate that we still will receive a full year worth of property taxes, but we do anticipate that some of it may be delayed. We did receive word from the Illinois Comptroller's Office based off of some of the extensions of deadlines that they've given to businesses on remitting sales taxes, extensions of deadlines on income taxes, that we can expect delays of distributions of state revenue from their office. They have been so succinct as to inform us that anything we were expecting in April can now be expected in July. So that has been included in the projections that we'll go through in a moment. So those would be impacting anything that flows through the state, which would include sales taxes, income taxes, which is commonly referred to as the local distributive fund, use taxes, personal property replacement taxes. All of those are subject to potential delays or sweeps in the future. Let's see. And as mentioned earlier, we do expect our interest income our interest revenue to be impacted negatively by this. Next slide, please. Okay. Adding to the challenges here, as we talk about monitoring revenue on a weekly or monthly basis, there are some significant delays in information reporting on revenues. As you can see, and as Trustee Bree mentioned as well, we will not have March sales tax revenue until July. That information is just takes a while to collect at the state level, and then it takes a little while for it to come down to the village level. Just looking at May, we will just be getting January sales tax revenue, April income tax revenue information, not the receipt, and then April building permit activity on a local level. So this is going to pose some unique challenges in terms of monitoring this information. And it is possible, given the changes of state operations, that some of these items may be delayed further, but we will continue to monitor this. Next slide, please. Oh, there you go. We're good. So included in your packet, as I mentioned earlier, is a draft of a financial model that we are working on to help us monitor some of these revenues. And I've taken an excerpt of some of that information here. As has been mentioned many times this evening, the information surrounding the pandemic and the finances associated with it and what's happening in the market is changing by the minute. And as you'll notice as we go through this presentation, we've already updated these numbers. So there's some areas here that you will see in the PowerPoint that may differ from the packet because we are monitoring this very closely. So that being said, we have already modified the what we are expecting in terms of property taxes. That is the village's largest revenue. You can see here they're received in 2 installments. Already received in March was the first installment, and the second installment is currently due in August. Within our projections, we don't know for sure, but what we are anticipating is that this deadline would be extended sometime in the fall. If that's the case, we would receive the lion's share of our property tax revenue probably in November, December time, rather than late summer. So we expect this projected amount of delay to be approximately $3.8 million. Again, that's a cash flow issue. We do expect to receive all of the property tax dollars this stub year. The next item is our local distributed fund, our income tax sharing. The state of Illinois recently received its budget projections from the Office of Management and Budget. You may have heard about this in the news. They are projecting that the state may lose as much as $10 billion this year in revenue. And what they are expecting is that they will see a 14 to 17% decline in their income tax statewide. As you may recall from budget discussions, income tax is distributed, collected at the state level, and then distributed to each municipality on a per capita basis. So we do think that a 15% loss ratio is a reasonable expectation at this point in time. Based on what we have budgeted for stub year 2020, we have $732,000 budgeted. A 15% loss would be just over $100,000. And just walking through the revenue loss scenarios from left to right. On each of these items, I have included the stub year budget, what we've received year to date, and the possible loss or delay that we may experience. So going from left to right here with the income tax, that far right column reflects the amounts of income tax that we expect to be delayed at this point, which would mean we would start receiving collections again in July. Next slide, please. Oh, thank you. On a sales tax level, we are predicting a 30% loss or just over $448,000. This is slightly more conservative than what the state is is predicting. We do expect that there will be a delay and a decline in this revenue, not only a loss due to those businesses that are closed, but also a delay due to the extension of the filing deadlines for sales tax revenue. This is a difficult one to predict, again, not only from the information of delayed, but we have an interesting mix of sales tax producing businesses in town. And while some of our businesses are closed, some of our businesses are operating at capacity right now. So this is something that we'll be monitoring very closely as we go forward. On a building permit level, we're anticipating a 40% loss, 40% decline in revenue. As we noted in the packet, we're currently aware of $178,000 in building permits that are in progress. Many of those are ready to be picked up and just have not been paid for yet. Many of those are in final stages of review. We've received about 80,000 year to date. 178,000 still leaves us with a long way to go. Without understanding the duration or the long-term impact of how long we will be under a stay-at-home order, or how people will feel about having contractors in their home to do remodeling in the near term, this is difficult to predict. So where we're projecting right now is a 40% loss. We think that's fairly reasonable. Next slide, please. The last item here is volumetric water revenue. As you have probably seen from the village's e-news and discussions that we have had, the village has extended late payment penalties on water and sewer billing for the time being through April 30th. So we do expect that there is going to be somewhat of a delay in water revenue. And we also expect that there is going to be a slight decline in water revenue. This one is tricky to predict as well. Having folks under a stay-at-home order, you typically would see a little bit more water usage. But as we recall from conversations last year, a big portion of our water revenue is driven by irrigation. So it is possible with the current economic conditions that some of our residents may opt out of irrigation this summer or some of their routine usage. So right now we're anticipating a 15% loss in volumetric water revenue. Next slide, please. Okay. In response to all of this, staff has been working on a multifaceted financial plan to adjust for delays or declines in revenue. That includes, as I mentioned earlier, seeking federal and state grant funding, reducing operating expenses, and delaying or deferring some of our capital projects. These are the things that we can do immediately, and together these items that have been identified would amount to approximately $1.9 million in immediate response of levers that we can pull today to adjust. If necessary, we've also identified a second tier of response. This would include the usage of fund reserves, bonding authority, and considerations of changes or reductions in service delivery. These are the three items that we would leave until absolutely necessary and would much prefer to try and be flexible so we do not get to that point. So we are still working through all the details of this response, and we're looking to identify additional savings or additional sources of revenue. But our hope is to develop a comprehensive model that gives the village board multiple levers to pull to respond to changing conditions. Next slide, please. Okay. This is the first page of the financial model, and I apologize that the numbers might be a little small on your screen, but this was included in the packet as well. And these numbers have been slightly adjusted for the items that we have talked about earlier. But just talking through the model from left to right, the first column shows actual numbers for March, and the remaining months show what we are projecting as of today. So we started with the budget and what we have received in previous years, previous months, and then adjusted it for the changes that we think will happen. As you can see in the red text on the top few lines, we've indicated those revenues that have been modified from budget for anticipated delays or decline and how much they have been adjusted. The beginning fund balance here is unaudited, but it does represent an educated estimate of what we believe will be our beginning unrestricted reserve balance. So this will be the reserves that we would be counting on in the event that things do not go as planned. And then at the very bottom, this shows the total revenue that we're anticipating by month. Next slide, please. Okay. And this is a continuation, this slide, the general fund expenditures, of the same projection, same format from actual expenditures that occurred in March and then what we are projecting going forward. And the thought process here is that this tool would be updated on a monthly basis, presented to the Finance Committee and the Village Board, and then we would be able to monitor these items in real time. So as those actual numbers continue to spread across the screen, we'll have a better idea of what's actually happening and have the ability to adjust as needed. At the very bottom of the screen, there's a line that shows the projected cash flow. This is on a monthly basis. And in a moment, I will talk about how this all flows to the bottom line. But the positive numbers here indicate revenues in excess of expenditures, and the negative numbers would indicate months in which we have expenditures that are greater than what we are anticipating in revenue. Okay. Next slide, please. In the water fund, we were able to fit the entire model on this slide. It's in the same format going from left to right with the actual numbers in the March column and the projected numbers going to the right in the gray. And we have adjusted volumetric water revenue for a delay and a decrease in revenue. Looking at the projected cash flow, going from left to right, we do anticipate a large influx of cash in the month of July. Right now, that's projected and would need to be a discussion point later in the presentation with the board. As you recall, we were anticipating issuing bonds in the month of June, understanding that that's slightly delayed now due to the stay-at-home order. And that bond issue has been scaled down in the projections to $3 million. So we'll talk a little bit more about that in a moment, but I did want to point that out, that both the bond proceeds at the top and the capital expenditures at the bottom have been adjusted from 5 million down to 3. Next slide, please. Thank you. Okay. This slide shows a similar picture for the motor fuel tax fund. This is not a large record-breaking year for the motor fuel tax fund. As you may recall from budget discussions, this is a fund in which we allow the motor fuel tax to accumulate. And then every third year, we do a large street project or road project from this fund. There was one small capital expense that was budgeted for this fund this stub year, and that has not been changed in the projection here. Next slide, please. Can we go one back? Can you go one back, Sharon? Thank you. Perfect. Okay. There we go. We're good. Okay. So the last fund model that we created was for the Capital Projects Fund. This fund is entirely based off of bond proceeds. So the balance that is in this fund represents the balance of the limited tax obligation bonds that were issued last fall. And these bond proceeds were earmarked for the Tudor Court project. As Manager Corrali indicated earlier, that's why the Tudor Court project is underway. We do have a 3-year time period in which these bond proceeds must be expended. And we're fortunate that we're able to accommodate this project right now. Next slide, please. Thank you. Now, all of these financial models flow forward through the bottom line, what we would have in terms of cash reserves. And this flows in a similar manner to the other slides that we've looked at. Starting with the left-hand column, shows the actual beginning balance. This is unaudited numbers, but these would be the unrestricted cash reserves that we would have available. Moving from left to right, from March through December, actually that should be, we should have a highlighted column in March, but this is what we would project in terms of cash reserves. If everything happens the way that we predict today, this would show what we would have to draw upon throughout the year. This does include the scaled down expenditures in the water fund. This does include what we are anticipating in terms of revenue declines. And as you can see, there are 2 low points, one in the water fund in April and one in the general fund in October. And that's primarily due to the shift in property tax revenues that we have done in the projections. And then the water fund, we were anticipating to draw that balance down slightly, which was why we were going to issue bonds in June. But overall, as with the projections as they exist today, the general fund and the water fund both maintain limits within the financial policy. And the general fund requires that we maintain 15% of operating expenditures, or $2.5 million, the larger of the two. And the water fund requires that we maintain a 10% fund balance. For the motor fuel tax and the capital projects fund, those both have targets of 0 because those funds are designated for a specific purpose. But we are projecting that both of those funds would end with a positive balance. Next slide.
Could I interrupt to ask a quick question?
Absolutely.
Thank you. So the December balances, but this is a stub year, short year. Of course, this is all set up with the notion that we need to have some reserves for January, February of the following year, before you start to get your next set of tax revenues, even under normal circumstances. So how does that play into what if you pushed it out 2 months in terms of where we think we're going to be?
Well, if what we had set aside originally for the months of January and February was $1.9 million. So that would draw that December number down by approximately $2 million. So total between the 4 funds, we would have about $7 million. That doesn't take into account anything that could happen between now and December. So I guess I would have to caveat that by if we do see revenue declines that are larger than what we are predicting, we'll have to adjust for that. But that's a good question.
Thank you.
Okay, next slide, please. Thank you. This is a graphical representation of our general fund projection, which shows our revenue, our expenditures, and our projected reserve. Under current projections, we will need approximately $1.98 million per month to operate the general fund. You can see the dip in October that we referred to earlier. Next slide, please. Thank you. One back. Thank you. And this is a graphical representation of the water fund projection, which shows the same revenue, expenditures, and reserve. And under current projections, we will need approximately $490,000 a month fund under current conditions. And that surge in revenue would be. Talk a little bit about the golf club and their financials.
This is Stella Nanos, General Manager of the Glencoe Golf Club. And just briefly to give an overview of what's happening at the golf club. As you know, we are closed. There is some good news. There are only 15 states that are actually under orders to prohibit play. And although Wisconsin today did extend their stay-at-home order until May 26th, they are allowing their golf clubs to open March 24th with restrictions. So we are hopeful that we will also be allowed to reopen by May 1st, even if the state of Illinois extends their stay-at-home order. So that was good news. The restrictions are pretty severe as far as the change in operations. The golf pro shop has to be closed completely. So there is no public interaction, which frankly is a great idea. So we don't have to worry about our staff interacting with the public, and the public doesn't have to worry about interacting with a lot of our staff as well. We've created an intercom system. We've changed our point of sale procedure to be able to accept online payments and over the phone payments, which took a lot of work. Thank you to Caesar and Matt for their work in getting that accomplished. The maintenance work on the golf course is still continuing. Unlike a store, the golf course is a living thing. We can't just turn our back on it and expect to reopen. So the maintenance staff has been working to keep us in good shape, and they are ready for us. If we get the call tomorrow that the golf course is in decent shape, that we can open up. We have cut our capital budget this year by 44%. The only items that are left on there are things that are essential for us to continue to operate successfully and things that were necessary timing-wise that we do complete. We have also cut our expenses. Our cash reserve fund at this time is quite healthy. We are sitting on $223,000 worth of permanent tee times, which are paid in advance for 19 weeks of play. They are expected to begin the first weekend in May. Hopefully we'll be able to keep that schedule with this group of individuals. If we have to extend it, we have already messaged out to them that we would stay a little bit longer into the month of September and extend weeks on end until we're able to open, but we're not going to go beyond 3 weeks extension. So hopefully at worst, we'll open up the third week in May for our permanent tee times. But due to that money already in the bank, we do have a $1.8 million cash reserve fund. That reserve fund is not only for our operations, but it's also our capital fund. So all of our money comes out of that. And you can see on the graph how that fluctuates. We do have zero, unfortunately, revenues in April. We've adjusted our revenue for the remainder of the year in accordance to what we feel the demand and the perhaps trepidation for returning out into the public will be. The National Golf Foundation has issued quite a few reports and surveys that the interest in golf has increased dramatically through the weeks, using Google searches when our golf course is going to open up. And you can actually see that the demand in that has been going through the roof recently with the warm weather. So we're hoping that we are able to open up as quickly as possible. We're ready for a no-touch registration process to keep our staff and the patrons safe. And we are anticipating with our adjustments that we will have a 26% dip in our cash reserve fund. But as I stated, our cash reserve fund is very healthy. We will end up not making money again in that reserve fund until May of 2021. And at that point, we will have a balance of 1.3 that is still existing in the cash reserve fund. So that it's not a great year, obviously not making money right now. We hope to open up as quickly as possible. We're ready to do that with restrictions in place. And even though it is not going to be a great year, we will not be in harm's way of not being able to take care of payroll and expenses and capital for the year. And that concludes the golf report.
Yeah, the next slide, Sharon. Okay, thank you. So as you've heard tonight, information is changing very rapidly. So in terms of next steps, what we're proposing is that staff continue to monitor these trends on a weekly basis, just looking for payment delays or declines, any delays in state shared distributions. And then also we would update the Finance Committee and the Village Board on a monthly basis through the Treasurer's Report and through updating these projections. Lastly, we're also proposing immediate steps to conserve village resources, implementing the delay and deferral of general and water fund capital where possible, reducing the water fund bond sale size, non-essential staff hiring freeze, and reductions to the operating budget where possible. And before I move forward, I have one more slide, but are there any questions on any of these items or any comments, any thoughts on where we're headed? If you're comfortable in this direction.
If I could add just a comment, again, this is Phil Corrali, the village manager. The intention at this time, I think given all that Nikki has walked through, is that we do what we can to conserve resources while we wait for data. And we have projections that are, I think, thoughtful and conservative, and at the same time, a very, very dynamic environment that we are living within. And the intention at this time is to, I think, look at the resources that we have to find where we may be able to delay or defer the expenditure of some of those resources. And as the year continues, and as we continue to dialogue at the staff level and then with the Finance Committee and the entire village board in the coming months, to reassess whether situations have changed, whether there are now resources perhaps that are available for some or a portion of what we had anticipated doing this year. As Nikki stated, we are in the process of highlighting which of the capital items in this year's community investment program we can perhaps defer or delay. Many of those are vehicles. Some of those are infrastructure. We intend to share that information with the board next month as we tie that up into a better scheduled out set of options. But again, the intention at this time is to reduce our expenditures while we watch this and wait for some additional data to come to us, realizing that we are no doubt going to see budgetary impacts this year. Those budgetary impacts are likely to last until next year and perhaps subsequent years after that. But we are barely a month into this. And while it has moved very quickly, as the economy starts back up over the coming months, it will be that I think will be the time where we have a better sense to make significant changes, both in the short and the long term, rather than recommending that we do that now. And so that the set of immediate steps that we have before you, while the bond fund reduction is something that perhaps has a more long-lasting effect, it also preserves our options into the future. The others do the same. It's about preservation of options and preservation of cash.
Phil, I've got a question, or Nikki or whomever. So if we hit a point where the funds we get from the state are so delayed, where we start getting to what's an uncomfortable level in our reserves, how are we going to deal with just cash crunches as a result of what's going on in the state of Illinois? Because you have to figure the state will have similar issues, and so for it to go through the state then to us, really we have no idea how long things could be delayed. So what would be triggers for us to either convene as a board to talk about what can be done, or what would you guys do? Would you just step forward and say we're going to delay, or I don't know what the levers would be, but how do we deal with something like that?
So I'll take this, Phil, and if you'd like to jump in.
Yep.
So I think I hate to answer your question with a question, but I think it depends on what we see. I think if we start to see drops in accordance with what we are projecting, or within even the next tier of what we are projecting. When we were talking about sales taxes, we had a 40 or 30% decline, and then it escalated. If we start to see that going outside of that corridor, because we're going to be monitoring this on a weekly and a monthly basis, that's when I think we need to recommend pulling some of these triggers in terms of operating expenses and delaying and deferring capital. Some of these items we can take immediate action on, and that we may do so just from a conservative standpoint, because we don't know what's going to happen. A lot of the items that we've identified that can be delayed or deferred, we can just as easily pick them up next year if things turn out better than what we are anticipating. The hope would be that we don't get to a point where we have to dip into reserves. But if everything took a turn for the absolute worst, that's where we would go to that second tier of the financial response, where we would rely on fund reserves, where we would start having difficult conversations about, do we modify service levels? Do we have to make some changes to the way that we operate? And if we get to the very last resort, what we would not want to do is to borrow for operating, but we do have the ability to borrow in times of deficit if we really had a problem or had a need.
What would the board's role be in all of that? So if we get to a point, I'm just talking, maybe not the worst case scenarios, but bad case scenarios where we're at levels that we're not comfortable with. Where is the line drawn between what you guys have freedom to do?
Let me project some thoughts along that line. Right now, what we've done is Nikki has gone through things that we can do to keep us in a position where all our options are available till we can get more information to see where this is going. As that develops and we start seeing where this is going, suppose it really were going south. All the decisions about, do we cut out capital stuff? What capital do we cut out? Do we move to looking at doing operating change? All of those are board decisions, where what is being done is putting together a methodology by which the staff can give us information and recommendations that will allow us to make those decisions. So in a frank way of putting it, the staff does not have the ability to decide what gets cut, what gets changed, where it goes, whether we borrow money or don't borrow money. That's our decision, but we make it based on listening to rational and carefully laid out options that the staff is responsible to bringing to us.
But just a quick question, just functionally, is there a trigger where it's in between a meeting? And I mean, I'm just sort of thinking about this is probably not, probably not moving this fast, but if it was, yeah, I know. But, if it got to the point where we're in between meetings, what would trigger we need to talk, and we need to convene?
I would say from the village manager's standpoint, if it is that dramatic, we would call an immediate emergency meeting to dialogue about the sudden change. My expectation is that while things will move very quickly, they should not move that quickly. Now, we don't know, and I won't promise that they would never move that fast, but I think to Nikki's point early on, we're in a better position right now to handle some of these short-term, which again may become long-term, but short-term revenue scenarios that may require us to rely upon cash reserves to get through to a next point. And I think that ties back to this ongoing dialogue between the staff and the board in these meetings that we will have. I would propose that we cancel 0 finance committee meetings and 0 village board meetings in the remainder of 2020, so that everyone is participating in the process of us sharing information with you and you ultimately making decisions. When we talk about delay or deferral of capital, we're not saying we're not going to bring them forward. What we're saying is we're trying to triage right now what is something we could wait a little bit longer on. Obviously, tonight there were a few capital items that showed up on the board's consent agenda for approval. Again, those were tied to areas where we thought those investments were important right now. There were several that at my level, I made the decision to say, let's hold at least until May so that we have a better sense of where our cash flow may be. And those were things such as a $100,000 sidewalk contract and items that we could add to a future agenda with relative ease, information that's at hand. But from our standpoint, the timing was not quite right during the course of the fiscal year, which is the direction that the village board provides to me and the staff, and the approval of the budget is to bring back to us when we're ready for it, those types of things. That being said, when it comes to cancellation of something, that isn't something that we do. And so if we're talking about a hiring freeze, what we talk about right now is a non-essential hiring freeze to get us through at least this period of the stay-at-home order, so that we have a better sense before we march down the path of working to authorize the position. So those, it's a timing issue for the most part right now. I think as we get down the path a couple more months, we are going to have much more specific conversations with recommendations from staff on this is what we're seeing, this is what we believe is the best course of action. Board, please give us your direction with that information at hand.
Let me give you some perspective. Having gone through what we had to do in the last recession and been a major part of the board working with staff to get us through that, we're in a far, far better position than the village was the last time we had one of these crises. One, we have much better reserves. Two, it hit at a time when we had just received a major portion of our property tax, so that we have basic operating funds sitting in the bank on top of the reserves that we had at that point to see us through to year end, so we can, by deferring things, leave open all our options as to what the board wants to do once we get clarification on where all this is going. Secondly, the planning has begun much earlier. While this was a very real crisis, I have to highly commend staff for the work they've been doing to try to figure out how to present to us basic set of options of how we get to year end, giving us those months between now and then to try and get clarity on where it's going without damaging our ability to cut things that then will leave us in a position to properly fund what we want to do for next year. So I think that there's a lot of discussion and stuff, and we may have some long meetings, for example, next month and that. But I think we're in a lot better shape given where we are right now than I've ever seen us under these kind of circumstances.
This is Gary. I heard that we are going to be looking at things, that the finance group is going to be looking at things weekly. And I'm wondering if it makes sense for the finance committee to actually either formally meet or at least for Nikki and her group to send out information to the finance committee on a weekly basis, sort of updating the kind of information that we're receiving with real time, so that by the time you get to a monthly meeting, it's already coalesced.
I would probably tend to amend that to say if there are any significant changes to do that, so that when they're supplying us with information, they're supplying us with information that we find useful. I mean, monthly meetings may be just guiding how we look at things and waiting to see what happens, and it could develop plans that are alternatives depending on what goes on.
I would say, as we look at that, I would agree with President Levin. Some of it may be too difficult to thoughtfully put together on a weekly basis. We don't get revenues in real time in a lot of circumstances, as Nikki kind of walked through. What we do get in real time are the things that we collect that are coming straight to us. Some of it may be unremarkable, and I think that doesn't necessarily mean it's bad. So I would say, for the moment, leaving it at the staff level to review and consider trends or issues that are coming up, and then sharing, if there is something, to President Levin's comment, that is interesting or may be particularly timely, to make sure that that information is being shared, which is something that we would do at any point in time if there was something that was of that nature. I just don't know that we are going to be able to put together something for the board's digestion on a weekly basis that's going to be valuable to you as you're trying to piece together what it means.
Fair enough, and I appreciate that, but I just want to make sure that you all, that you and Nikki and all the rest of the staff understand that, to the extent that it would be useful to you, that's what we signed up for, and if it's more time for us, so be it.
Thank you. That is helpful, and we know that, and we appreciate that very much.
Some of also what I was thinking is just setting up triggers that would say this warrants further discussion. Now, you guys may not need them, but that's part of what I'm talking about, is if something, so there's no, it's a little bit more black and white. So there's not a, I don't know, going in. And that may not be possible, but it's just something that was more of what I was thinking, is these triggers that warrant then further discussion, either with finance or then broader with the board.
Joe, or
I was writing notes. Sorry for the silence.
No, so Larry, do you want me to comment?
I was asking, did other trustees wish to comment? Joe, did you have any thoughts?
In terms of specific triggers, I mean, I'm certainly open to have that debate. I think we're all relatively to convene. I think we can now do it digitally fairly quickly. So I think we should just understand this is a time when we're expected to be relatively dynamic for the next several months, and so that's my thought.
Thank you. Gail, any thoughts?
I would say that the presentation, of course, was extremely thorough. I am pleased to see that we are in this mode of really examining, every potential source of income, and more importantly, all of our expenditures, because I think this is a time when we need to be so very careful, given the state of the economy and the state of Illinois. So I think it sounds like we're on a prudent course. Thank you.
Barbara, any thoughts?
No, I'm comfortable with the course we're taking. I certainly support what Gary said about our being available. If anybody on staff wants to send out some information, but I'm comfortable that they do that anyway when things come up. I think Phil always contacts us, and so I'm comfortable with the idea that the staff will trigger a meeting when that's appropriate to do so. And yes, we do have to stay flexible, and that's pretty easy now, I think. Probably none of us are traveling for business, et cetera.
And just think of all the fun we have having these meetings on TV like this.
I was hoping we could do more of them.
Peter, any thoughts?
I concur with Joe and Larry that this is a time where we need to be available, dynamic, and flexible. But I also think that we need to be willing to be bold when necessary, right? It doesn't seem like we need to take that bold action now, but stay the course, but be willing to make tough choices when needed. Don't want to pretend like everything is going to always be, we're going to just manage this through by being prudent and careful. It may take more than that. I don't anticipate what that might be, but just an awareness of it may be necessary.
Thank you, Peter. Jonathan, any thoughts?
No, I said my piece. All sounds good.
I would mention one spot of interest that we're looking at as well, which nobody knows the answer to. While we have the sales tax, in a sense, going down because so many merchants are not able to operate in this, there is an awful lot being done on the internet. And so I think the laws that the state passed in the last session that caused tax to be paid on those internet sales and then distributed to the villages and the municipalities in Illinois on purchases made by our residents may in fact help to offset some of that loss in sales tax. But it's also new. It's impossible to tell what's really happening there, and that's one of the things that staff's going to be watching as well. I just thought I'd mention that since there is some good rays of light in all this.
And Binny's is extremely crowded.
Yes.
How do you know about that, Trustee Vree?
So I've heard.
As several states commented, they didn't know who was doing more business, the liquor stores or the gun stores.
Well, the pot stores are also doing a lot of business. The people I know that frequent them say that they don't even have, they just run out of supply within, half an hour of opening. So it's I like to visit some of the people that were and talking about other revenue streams, because I think this is that turned out to be way bigger than I ever anticipated.
Speaking of other revenue streams, this is not the meeting for it, but I just want to mention again that this crisis is another example, I think, of why, if we were a home rule community, we would have more levers, I think was the term that was used earlier. We'd have more options, we'd have more flexibility to be able to meet a crisis like this. And so obviously that's a longer term issue, but it's certainly driving the point home to me.
And I think it's an issue that as we look at all this financing, the board needs to be helping us in putting together a recommendation if this isn't really the time to go talk to our residents about it. Because, we kept saying, well, if there were an emergency, we could see this more. Well, we are right in the middle of that emergency. Other thoughts?
President Levin, if I may just highlight one of the items on this slide. We mentioned that we would talk about this a little bit more in detail in terms of reducing the water fund bond sale size. What we had proposed in the financial projections was scaling back from a $5 million bond issue down to a $3 million. That would provide sufficient funding for the water meter project, understanding that there may be some challenges completing that project, getting people to allow us to go into their home to change out a meter, but then also provide 1 to 2 years of water main projects, understanding that if we do need to, we can go out to bond for that again in the following year or the year after. Are there any concerns or thoughts specifically about modifying that bond sale?
I think, again, the logic behind that in our conversations internally has been not to overstress the water fund. If we anticipate perhaps some reduction in revenue in the water fund, that while we have the work that needs to be done in the water system and have planned for it, we don't want to overwhelm the fund at a time where other funds are not available either. And so I do think we can provide additional detail as to what that means in a subsequent meeting. We have to complete a formal process. As you may recall, with the Tudor Court bond issue last year, we have a similar process that needs to be undertaken, including a public hearing, and that has not happened yet. And so this is, again, all conversational. It isn't a final at all. But that is kind of the logic that we have behind it. It would still provide some additional resources to do about $1 million worth of water main work, in addition to the approximately $2 million anticipated for the water meter project.
I just have a quick question about the bond issuance in terms of how flexible we can be. I mean, the bond market has not acted particularly normally over the last month. So if we go down the path of wanting to issue a $3 million bond, and we're in the midst of another one of those situations where the market is not acting well, how flexible can we be on something like that?
The board has the ability to disprove or disapprove the bond sale results. So if you recall, as part of the process, we go through a hearing process. There's a ratings call that would occur, and then the bond sale would go essentially to a live auction. And the results are presented ultimately to this board for your approval. So if the results were not favorable, we certainly would not need to go forward with it. And we could cancel that. There are some expenses related to the bond issue that would be incurred leading up to that. But if it makes sense to not move forward, that process could be stopped. We have had some preliminary conversations with our financial advisor. I understand that there have been some limited bond sales that have gone through in the municipal market recently that they were handling. But you're right, as of today or currently, there's not a large market for municipal bonds. Right now, I think there's just a lot of fear surrounding that. Our hope is that once the governor's order is lifted and things start to return to whatever the new normal may look like, that activity will pick up again. There will always be a need for government borrowing, and that market will need to take hold again. We just don't know what that will look like.
And then, so on the other side, the flip side, how can we prepare so if we get a window where markets look fine, issuing it reasonably quickly? I mean, is there a way for us to prepare so when that window opens, we're ready to go ahead and issue the bond?
What's tricky is as a non-home rule community, we have some very specific steps that we need to follow. As the manager just mentioned, we do still have to go through a bond hearing, and there does still need to be, with an alternate revenue bond, a petition period that allows anyone from the public that disagrees with our choice to issue bonds, that they can file a petition to object to the process and force the village to go through a referendum process to issue bonds. So we do still have to allow for that time period, that gap. Typically, it's gaps of 30 days. You do have to give notice of a public hearing, which we've temporarily suspended because of this conversation. And then we would need to allow for that 30-day petition period. So regardless, I think if we move forward with a public hearing, that would allow us, that would shorten that time frame period by 30 days. If we opted not to go forward with the bond issue, then we would start that time period over again.
Remind me, how long do we have after that 30-day petition period to then issue the bond? So if we're through it all, we've done everything, do we have to issue it within 30 days? Is it an open-ended 6 months? How long do we have? I mean, could we just get it done now and then have it sort of sitting out there as soon as things are reasonably normal? We then go ahead and issue?
Let's see here. I believe the authorizing ordinance, I want to say, is good for 6 months, but I have to double check that.
Nikki, I'm pretty sure it's 6 months.
Yeah, the other issue, Jonathan, the other issue that exists relative to our current situation is that bond counsel has not necessarily been comfortable with holding these public hearings via virtual meeting. And so we are in communication with them on that. But that may also be a hindrance to moving forward in the short term.
I was just going to raise that, Phil.
Yeah.
That's one reason why, if things were to change, so we could, because I remember our May meeting this year is like the 21st of May, which is later in May. We should be ready so that if we do want to go forward with this and we're able to hold a meeting where we all come together in a normal public meeting in May, at the end of May, that we're able to do that so that we're in a position then to have our option to move expeditiously if needed.
And Phil,
Go ahead.
I just wanted to state for the record, I personally and our firm disagrees with that opinion of bond counsel, but we're not the ones that are going to be issuing or signing the bond. And so we do have to defer to bond counsel. I am perfectly comfortable that this meeting is lawful, and I want to make sure that that's clear.
The other point to add to Larry's comment, we will continue to notice the board meetings that are coming the regularly scheduled ones as long as we need to, so that we can hold those public hearings if we have that meeting and the bond council's perspective changes, or we're meeting in person. We had noticed this meeting, as Nikki had mentioned, to be that BINA hearing, given the fact that the bond council was not comfortable. We did not move forward with it tonight. And so that may change, but we will notice the May meeting so that we can move forward if that's the case.
And speaking of changes, I was in conversations with our bond counsel last week, and they have moved a little bit on hearing requirements, and that they do still want at least one individual present to open the meeting to the public to allow for in-person comment. And they indicated that they're continuing discussions at their firm, understanding that the stay-at-home order may continue for an extended period of time, and he did indicate that their stance on that may change.
They'll come around.
We're hopeful that they will come around.
To my opinion.
That's what, as I always say, Steve is much brighter than all those bond councils.
On the
Just
other side,
that all makes sense, and I'm in favor of reducing it to the $3 million issue.
this is Pete. I was going to ask if there's a clear trend on the other side of this bond, on the contractor side. Are contractor rates up or down in this market, and does that do anything to offset higher bond prices?
I don't think we have that information yet, but I do think there is a potential for those standard pricing to change in either direction at some point. But I think that's a fair point. That was certainly the situation after the Great Recession, where unit prices came down fairly significantly in an effort to almost incentivize government to conduct work. But that is something we potentially may be able to avail ourselves of.
I also wanted to just ask about the timing of the project, because I think you were talking about, the bond offering in the summer, and with the current timing potentially that we're talking about, I mean, when would the meter replacement within people's homes actually take place? Because I think that's the other element that we need to be concerned about, in terms of people's comfort level and when that would be.
The initial timeline that we had set forth would be that we would have bond proceeds in June. Now, if we go ahead with noticing with May, we would have those proceeds in July. The original timeline that we had stretched out with that meter replacements would start August 1st. Understanding that may not be possible, we may have to shift that. But as of right now, that was what we had anticipated would be after August 1st.
Because I personally, have concerns in terms of members of the community wanting something like that in their homes, beginning so soon at a point where we don't have a vaccine, and where, they're still talking about continued virus involvement at that point in time. So I think that's something to consider.
To that point, trustee listener, we have not re-engaged with that contractor to discuss the timeline or to discuss what additional measures they may be taking relative to that work. And, I think we're in an environment where even, again, a month ago, we didn't have the knowledge that we have right now. I think as we approach this, I think it may be still a stretch for us to commence that project August 1st. There are unfortunately a cascade of things that have to happen as well to make sure that when this process starts, it works. And that involves kind of the IT integration on the back end and the timing of the billing cycles. And so I think, will be looking at all of that as we progress through the next few months, tying that in with the bond sale and that process as well. So the good news is when we have the bond resources, we have 3 years to spend them. So if for some reason it's impossible to begin this fall, then we do have the ability to do that in 2021.
I think this is like a lot of things we're looking at right now. We can say, let's move forward in the sense of staff doing preparation, but until we see how all this goes, we're not going to know what it is we're going to do or not do. All we can do is have options, and I believe staff is doing an excellent job at looking at all the issues, including those Phil just laid out on these options, and we'll just have to make our decisions when we have much clearer and better information.
Nikki, should we move to the next slide? Because there are some additional, we need some more feedback from the board tonight.
Yes, please. Thank you. Okay, so just continuing next steps of what we're recommending as far as a way going forward. To continue our assistance efforts to the community, we are recommending continued utility bill penalty waivers through March, April, and May. Because we bill on a quarterly basis, if we do this for a 3-month period, that would provide this opportunity to the entire community. So that would hit all residents that would be in need throughout town. Obviously, to continue to delay water service terminations through June 30th. We've already extended the deadline for vehicle and pet licenses through June 30th. I'd like to give a huge shout out to our finance team that has continued processing these remotely. We've collected about $140,000 in revenue from vehicle and pet licenses so far. So there's been a very high volume over the last month. And then the last bullet item there is really a question for the board in terms of parking permit refunds. This isn't something that we have received a lot of requests for. I think we've heard from two individuals that have requested this, but understanding that most people are working remotely, we do anticipate that that would be something going forward. This isn't typically something that we would refund in a normal year. So that is why we're bringing this question before you. And then just to finish up the questions on the slide as to whether or not the places for eating tax would move forward. As you recall from the budget process, we did pass this as part of the budget package with an implementation date of July 1. So that would mean the first taxes that would be due from the restaurants would be due August 1st, the month following. The ordinance that was passed by the board does set this date, this effective date. So if we were to modify this, this would take an additional action of the board as to how we would like to move forward.
I could add just one thing. Again, this is Phil Corrali. As staff has talked through this, and I'll work from the bottom up, the deferral of the places for eating tax is something that we have, I think, a sense that would be both a minor impact to the village overall and be seen as a in this time of great uncertainty, an appropriate move on the village's part. It's about, if I recall from the budget, about a $30,000 in normal times for this period, this year, what we were anticipating revenue being generated. Again, that's in, those projections were made during normal times. I would recommend that we wait until January 1 and implement this on January 1 rather than July 1. What that would require is for us to bring back a ordinance to you at our next meeting, which would change that effective date from July 1 to January 1.
I think given the economic conditions and the fact that we want to try and be as friendly as possible to our restaurants, because we have good ones and we want to keep them, that makes good sense.
Yeah, I would be in favor of doing what we can to help our businesses. And this seems appropriate.
I'm perfectly fine doing it. I think it is. I'm perfectly fine doing it, and if you think that will be well received, all the better. But as you point out, it's not a large number one way or the other. But it is a further administrative hassle that we can delay having to put on them while they are, God willing, reestablishing their businesses and trying to get back up to thriving again. So I'm in favor.
Joe or Gail or Barbara or Peter, does anybody else have any thoughts?
Yeah, I apologize. I agree.
Yeah, I think it sounds reasonable given the circumstances.
Barbara?
Yes, I agree.
This is Pete. I agree with the deferral of places for eating. I'm not so sure about the others, but certainly on the restaurant.
Maybe Phil, could you have people been coming to us and asking for a parking permit refund, vehicle and pet license extensions? Has anybody asked for those?
Relative to the parking permit refunds, we have not received a lot of them. I think there is the potential that may change, but we have not. We put it here, frankly, to gather your feedback. If your feedback generally is that if it isn't our policy normally, then it may not be worthwhile. Then that's certainly direction that we can take. As it relates to the other items, the intention, and you may recall, this was done kind of midstream back in March, late March, as a means of outreach to the community as the pandemic began and as the stay-at-home order was undertaken. This is something that I think every local government around us has done in terms of the deferral of utility bill late penalties for a period of time. And I think what we're saying is, at first, what we talked about was kind of a deferral to the end of April. That would encompass essentially 2 billing cycles. The water service terminations is something that I think in this environment is appropriate to delay those service terminations for the time being, but again, to have a date certain. And with respect to vehicle and pet licenses, the deferral of the due date has not slowed people's renewals of their vehicle and pet licenses. But that was seen as perhaps an additional lever that the village could pull to provide something to the community as the community kind of dealt with the ramifications of the pandemic. So that was the thinking behind it, but certainly from a timeline standpoint, there are things that we could amend from what we've put here, but we were trying to align everything so that there was equality across all of our billing cycles, and from a timeline standpoint, it was easier, I think, administratively to manage it this way.
I would just like to say, I think all those things sound reasonable. Going back to that parking permit refund, personally don't see the necessity for it and don't necessarily think that it's a great precedent for us to start at this point.
Yeah, I get afraid of Pandora's box.
And I wouldn't say that staff is in favor of it either, but I think we wanted to affirm our perspective.
My feeling is that From utility bills through vehicle and pet licenses all fit properly. I'm not particularly, I don't particularly think refunding parking permit fees is necessary or appropriate, but I do definitely think deferral of the beginning of the eating tax as a way of showing our restaurants that we care about them, like the first group, is the proper thing to do.
This is Pete. I think these are all nice gestures. I think the critical point is that they all be applied equally to all residents, unless we specifically have conditions for certain subsets of the population. It can't be on a one-off basis. So the folks who have requested it, whatever the decision is, it needs to be consistent with the rest of any other request or policy.
I think you're absolutely right.
Understood.
Maybe what we should do is split the package by taking parking permit out of it. Is it the sense of the board? I think I'm hearing that everything other than parking permits is fine. And if that's the sense of the board, then what we can do is ask, let me just go down the list and see what you think in terms of parking permits. Having said that, I don't think we should refund them. Joe, what do you think about parking permits?
No, as I said before, I think you're setting a precedent, and you're going to start, and it could it's a place we don't want to go. Plus, no one's asked for them yet, and so that would be my opinion. Is no.
I think I heard 2 people ask for it. Is that right? 2 people.
Correct.
I missed that. Yeah, I still apologize. I think it's a tricky precedent. The state may be open by mid-May, and people can still go and use the parking lot.
Yes, I agree. I'm not in favor of the parking permit refunds and all of the other items on the list. I would be in favor of.
Thank you. Barbara?
Yeah, same with me. I'm in favor of all of them except for the parking permit refunds. And obviously we can revisit it if we get new ideas or information.
Peter?
Quick question on the parking permit funds. Is this something people sign up for and have automatic deduction, or are they each month making this decision? I just want to make sure we don't get into a case where, come, what are we now, April, in May, we're automatically pulling from their accounts in May. They may not be aware, they may not think of this as something they have to stop.
We actually do not auto debit on a parking permit. We do require folks to complete an application, and the majority of individuals purchase an annual permit or a quarterly permit. They do have the ability to purchase daily parking, but we typically see annual or quarterly permits.
In which case, I'm
issue a check. Sorry.
Yeah, thank you. So in which case, I agree with what's been said to date here. No refund, but yes to the other gestures.
Gary?
I agree as well.
Jonathan?
Yeah, I agree with everything that's been said.
All right. That I think gives you the direction you wanted, Phil.
It does. Thank you, everyone.
If there's nothing more on what we've been looking at in terms of budgeting, the question is there any other business that anybody would like to raise? I'm not aware of any public comments that have come in through the meeting.
There have been none, President Levin.
Okay. Then at that point, I think we've spent an interesting and long evening. Could I have a motion to adjourn?
You bet.
Steve Mulvaney was mover. We need a second. Trustee Hallak, second.
I think I heard that there was a motion and a second.
There was.
Okay, may I have a roll call vote, please?
Trustee Hallwell.
Yes.
Trustee Listener.
Yes.
Trustee Miller.
Yes.
Trustee Mulvaney.
Yes.
Trustee Rubin.
Yes.
Trustee Vree.
Yes.
Well, let me start by saying thank you to all of you for spending all this nice time with us. And thank you, Steve and staff, for the terrific job you did. A good night and to all of you. I think we stand adjourned.
All right.
Thanks, everyone.
Everybody.
Well, everyone.
Well.
Bye-bye.
Good night.